has been recommended by the Government of India, number of deliveries per month and number of beds. So if there are 250 deliveries in a month, 4 SDU beds are required. If the delivery is between 250 to 500, 8 delivery beds are required. And if the delivery load is more than 500, number of beds can be increased proportionately. Now it is recommended that all district hospitals should have an obstetric SDU and all the medical colleges should have both an obstetric SDU and an obstetric ICU. So what should be the staff pattern in obstetric SDU? Obstetrician is in charge of this SDU. EMOC and medical officers around the clock should be present. Obstetric nursing staff 24/7, and nurse to patient ratio should be 1:2, 1 extra for day off. The supportive staff required are pharmacists, dietitian, counselor, housekeeping, data entry operator, electrical technician and security, and all staff should be trained in recovery care and CPR. So the obstetrical patient maternal fetal unit is looked after by the intensivist who is in charge, then medical specialist, ICU nurse specialist, then case management, managers social services, clinical pharmacists, their own family, spiritual care, respiratory therapist, perinatal nurse and maternal fetal medicine specialist. Now staff requirements of 8-bedded HDU. So 4 dedicated nurses and 2 EMOC or medical officers. 4-bedded HDU, you need 2 dedicated nurses and 1 EMOC or medical officer. And for 4-bedded obstetric ICU, 4 dedicated nurses and 1 intensivist. Then there is a triaging policy. The obstetric SDU, the labor room and the obstetric ICU. If the patient is in labor room, she may require the obstetric SDU or obstetric ICU, or she can be discharged if it is all right. In an obstetric SDU, the patient, if recovers, goes to the labor room or the postpartum unit and she gets discharged. In the obstetric ICU, the patient steps one step down, goes to the obstetric SDU, postpartum unit, and when she recovers, she is discharged. So what are the parameters which are required for admission in obstetric SDU? Systolic blood pressure less than 90 or more than 160 mm of mercury. Diastolic blood pressure less than 50 or more than 110 mm of mercury. Mean arterial blood pressure less than 60 mm of mercury. Heart rate less than 60 or more than 110 per minute. Respiratory rate more than 25 per minute. Urine output 0.5 ml per kg per hour or more than 30 ml per hour. Any single organ dysfunction can be present. Then what are the parameters which are required for admission into obstetric ICU? Respiratory rate less than 8 or more than 35. Heart rate less than 50 or more than 140 beats per minute. Systolic blood pressure less than 80 mm of mercury. Then urine output is less than 400 ml in 24 hours, less than ml task. Then Glasgow coma score less than 8 in the context of non-traumatic coma. Any unarousable patient, serum sodium potassium outside the range, ABG abnormality, need for advanced respiratory support, DIC, ARDS and inotropic support, and multi-organ failure. So basic principles for obstetric emergencies: both mother and fetus are affected by the pathology and subsequent treatment. Mother's welfare always takes precedence over the fetal concerns, and fetal survival is dependent on the optimal management. So remember, during interpretation of lab results in critically ill obstetric patients, always consider the normal physiological changes of pregnancy, otherwise underlying disease may be over or underdiagnosed. So what are the changes in pregnancy? There is increased cardiac output, stroke volume and heart rate, decreased systemic and pulmonary vascular resistance, decreased blood pressure in first and second trimester, but it rises again in the third trimester, decreased serum colloid osmotic pressure. So impact on resuscitation is increased CPR circulation demands. The respiratory changes are increased oxygen consumption and demand and metabolic rate, increased tidal and minute volume, but no change in the respiratory rate, respiratory alkalosis, decreased functional residual capacity but no change in vital capacity, and impact on resuscitation is that hypoxia develops quickly. Then hematological changes are increased plasma volume, hemodilutional anemia, hypercoagulable state, fall in platelet count, and the impact on resuscitation is reduced oxygen carrying capacity. The renal changes are there is hydronephrosis, increased renal plasma flow, GFR and creatinine clearance, proteinuria that is less than 300 milligram per 24 hours, and reduced excretion of sodium and water load which result in peripheral edema. So aortocaval compression causes supine hypotension. Then the GIT system, there is reduced GIT motility, relaxed lower esophageal sphincter, increased liver metabolism, and impact on CPR is increased risk of aspiration. There is breast enlargement and laryngeal edema, reduced esophageal tone, therefore there is difficulty to intubate, there is high risk of aspiration, and so the airway must be secured very early. In cases of aortocaval compression, there is reduced venous return and cardiac output by 30 to 40%. So uterine displacement is done in a left lateral tilt if CPR is not required. Then uterine blood flow up to 10% of the circulating volume. There is predisposition to hemorrhage and hypovolemia, aggressive fluid resuscitation, so the uterus must be emptied early to increase circulating volume and reduce O2 consumption. There is dilutional anemia, which reduces the oxygen carrying capacity. There is reduced functional residual volume from increased minute ventilation and diaphragm splitting, increased O2 consumption from uteroplacental unit. So rapid development of hypoxia occurs, so we should give early high flow oxygen. So recognition and assessment of critical conditions in obstetrics is important. So how to approach? Now aims of the critical care are the priorities in dealing with the critically ill patient are immediate resuscitation, assessment of the deranged physiology, systematic organ by organ approach. These are generic regardless of the primary underlying pathology and will precede more specific diagnostic considerations. So we must remember A, B, C, D, E. So what are the alert signs in settings of maternal collapse? Airway obstructed or noisy, breathing, respiratory rate less than 5 or more than 35, circulation, the pulse rate less than 40 or more than 140 beats per minute, and sudden decrease in level of consciousness. The patient becomes unresponsive or responsive to painful stimuli, and seizures may start. Now the possible causes of maternal collapse can be eclampsia, epilepsy, cerebrovascular accidents, vasovagal syncope, then MI, arrhythmias, pericardium, cardiomyopathy, CHDs, dissection of the thoracic aorta, asthma, pulmonary embolism, pulmonary edema, anaphylaxis, then abruption, uterine atony, genital tract trauma, uterine rupture and aortic aneurysm, hypoglycemia, amniotic fluid embolism, septicemia and complications of anesthesia may cause maternal collapse. So can women at risk of impending collapse be identified early. So an obstetric early warning score chart should be used routinely for all women to allow early recognition of the women who is becoming critically ill. So often there are clinical signs that precede collapse. In some cases, maternal collapse occurs with no prior warning, although there may be existing risk factors that make this more likely. The first early warning scoring was introduced on this basis and is now extensively used in acute settings and critical care. So maternal early warning criteria from the National Partnership for Maternal Safety are the systolic blood pressure less than 90 or more than 160, diastolic blood pressure more than 100, then heart rate less than 50 or more than 120, respiratory rate less than 10 or more than 30, oxygen saturation or room temperature at sea level less than 95 or liguria, then maternal agitation, confusion or unresponsiveness, patient with preeclampsia reporting a non-remitting headache or shortness of breath. So these are the modified early warning scores. And if the score is less than 2, a qualified nurse is to review the patient at next handover. If the score falls between 2 and 3, a qualified nurse should review immediately and repeat observations and initiate therapy as prescribed. If the score is 4 to 5, then qualified nurse should review immediately, repeat observations and instigate therapy as prescribed. Junior doctor should review within 30 minutes. If the score is within 6 to 7, then qualified nurse should review immediately, repeat observations and instigate therapy as prescribed. Urgent review by senior resident, and you must inform the critical care in charge. Then if the score is more than 8, the urgent review should be done by the medical emergency team immediately. So now prognostic scoring criteria. This is the SOFA score, and this modified Apache and SOFA score, and this says whether the patient will improve or not. So the obstetrically modified SOFA score, Q SOFA score is the clinical parameter in the scores: systolic blood pressure less than 90, the score is 1, respiratory rate more than 25 per minute, the score is 1, altered mentation any state other than alert, the Q SOFA is 1. The Q SOFA score is equal to 1, indicates mortality 2 to 3%, and if the score is more than 2 or equal to 2, the mortality is more than 10%. Then this is the full Pyre model, which aims to identify the risk of fatal complications in women with pre-eclampsia within 48 hours of hospital admission, and it has been found to be very useful in low resource settings. So to confirm the diagnosis, we need clinical examination, lab investigations and radiologic investigations, and the coagulation screen, urea, creatinine, liver function tests, and the total protein has to be monitored. Then ABG, that is PaO2, PaCO2, SCO2, pH, then CBC has to be monitored. Then ABG values during pregnancy: pH varies from 7.4 to 7.46, PCO2 from 26 to 32 millimeter of mercury, PO2 101 to 106 millimeter of mercury, and bicarbonate 18 to 21 milli equivalent per liter. So recommendations for diagnostic imaging are: we can use ultrasound, MRI, and in certain cases X-rays and CT scan also can be used. The radiation exposure from most of the investigation is less than the dose associated with fetal harm. If X-ray and CT scan are necessary, or more readily available than ultrasound and MRI for diagnosis, then they should not be withheld from a pregnant woman. So, role of imaging in critical care: evaluation of neuropulmonary disease, evaluation of cardiovascular disease, hepatic disorders in pregnancy, neurological diseases, obstetric hemorrhage and sepsis. A common requirement in all patients, irrespective of the organ system involved, is evaluation of gestational age and fetal well-being by ultrasound. So, there may be imaging in the first trimester for ectopic pregnancy and RPOCs, in the second and third trimester, placenta previa and uterine rupture, and postpartum for RPOCs. So, oxygen therapy is delivered by nasal bronchs, which gives 1 to 6 liter per minute. At the rate of 1 to 6 liter per minute, 24 to 44% of oxygen is delivered. If you give by face mask, 5 to 8 liter per minute, 40 to 60% of oxygen is delivered. If you give by venturi mask, 2 to 15 liters per minute, and 24 to 60% of oxygen is delivered. And partial rebreather mask, 6 to 15 liter per minute, 70 to 90% is delivered. And non-rebreather mask, 2/3 filling of bag, 90 to 100% of oxygen is delivered. So, minimal acceptable SPO is 95%. So, patients with acute ventilatory failure, they need intubation and ventilation. If they are conscious, cooperative, stable, hemodynamics and active respiratory drive and intact upper airway, then BiPAP or CPAP can be used. So, we all know that shock and fluid resuscitation, we give normal saline and ringer lactate in, with a high flow. So, crystalloid solutions for intravascular volume replenishment are typically isotonic, that is 0.9% saline or Ringer's lactate. Ringer's lactate may be preferred in hemorrhagic shock. It minimizes acidosis and will not cause hyperchloremia. And for patients with acute brain injury, 0.9% saline is preferred. Colloid solutions such as albumin or dextrans are effective for volume replacement during major hemorrhage, but are not commonly used. Hydroxyethyl starch increases the risk of renal injury, and albumin has been associated with poorer outcomes in patients with traumatic brain injury, and blood typically is given as packed red cells. It should be cross-matched, but in an urgent situation, 1 to 2 units of type O Rh negative blood is an acceptable alternative. So, grading of blood loss in obstetric patient. Blood loss 15%. The respiratory rate is 14 to 20, heart rate less than 100, systolic blood pressure normal, mental status anxious, and urine is more than 30 ml. The fluid given should be crystalloid. In class 2, 15 to 30% of blood loss, respiratory rate 20 to 30 per minute, heart rate more than 100, systolic blood pressure normal, mental status anxious, and urine 20 to 30 ml per minute. Per hour, sorry. Then crystalloids have to be given. In class 3 shock, 30 to 40% of blood is lost, and the respiratory rate is 30 to 40. Heart rate is more than 120. Systolic blood pressure is decreased, mental status is confused, and the urinary output becomes 5 to 15 ml per hour. And crystalloid and blood should be given. And in class 4 shock, the blood loss is more than 40%, respiratory rate is more than 40, heart rate is more than 140, systolic blood pressure is decreased, mental status is lethargic, and urine is negligible. So, crystalloid and blood should be given for resuscitation. So, blood and blood component therapy in antepartum period, if the hemoglobin is less than 7 gram per dl, or at above 34 weeks, if the hemoglobin is less than 5 gram per dl, we can give blood. We should give blood. Then in cases of post-operative patients, in hemodynamically stable patients, transfusion should be considered if hemoglobin is less than 8 gram per dl. And patients in ICU with sepsis, hemoglobin level less than 7 gram per dl, we should give blood. The target hemoglobin is in between 7 to 9 gram per dl. So massive transfusion protocol can be applied, and the new entry is not very new, but recombinant factor 7A. This is being used for intractable blood loss and fulminant DIC, as it induces short-term local hemostasis. It is a promising alternative to blood component therapy and has been used for the treatment of obstetric hemorrhage with life-saving results in some cases. Care for the fetus in the obstetric HDU, fetal morbidity and mortality reflect on the maternal condition closely. Simple measures such as avoidance of supine hypotension by a 15-degree left lateral tilt and oxygen via face mask can improve uteroplacental oxygen delivery. Fetal condition should be by continuous electronic fetal monitoring, and steroid should be given if the fetal gestational age is less than 34 weeks. Labor and delivery should be conducted as per maternal indications or fetal indications. Resuscitative hysterectomy can be done if there is maternal collapse and in cases of maternal cardiac arrest. So we also, every time we should remember 7 C's of the critical care: compassion, communication, consideration and avoidance of conflict, comfort, prevention of suffering, and carefulness, consistency, and ethics and withdrawal. Take-home messages: critical care is the need of the hour to help decrease maternal morbidity and mortality. 5 women in India die every hour during childbirth. In an endeavor to save these lives, we should train our obstetricians in the art of critical care. All patients need to be stabilized and safely transferred to an ICU or HDU. Skilled labs can help us train obstetricians to intubate, resuscitate, revive and save lives. Thank you.
Thank you, Dr. Alka Pandey. You have given your orations very nicely and lucidly, and we try to improve with infrastructure. Of course, we need a lot of manpower, a lot of your infrastructure development, for monitoring the things. But I remember 30 years back, in our labor room, rooms, it's called December night. I think at least 20-30% lie on the floor, and many of them lost due to your critical condition. But nowadays we have improved the last 3 decades in terms of infrastructure, also manpower, thanks to COVID, and a lot of our ventilator due to the philanthropic donation, as well as from the input from government. We have improved like anything. As a result, we have reduced the maternal mortality, at least in our stats, less than 50. So thanks a lot for your kind, lucid presentation, and then
thank you, sir.
Thank you so much, sir.
Well, next oration is none other than very dynamic, kind-hearted human beings, Professor Rishikesh Pai. He is in MD, FRCOG, UK owner, FCPS, FICOG, MSc, USA. He is now the President of FOGSI, Plastic FIGO, Asia Oceania, 2023 to 2035, Chief Administration of FOGSI Manipur Program, Project, Group and Society Relations of FIGO Governments, Cancer Committee, Director of Bloom, IVF, Director of Corporate Affairs, Intern, Federation of Fertility Society. First, Professor D.Y. Patil Hospital, Leelavati, and then present editor of Indian editor of British Journal of Obstetrics and Gynecology and founder editor of IA Journal. He also the editor board of the Global Reproductive Health and board member IVF Worldwide, past president of ISAR IAG, Mumbai Option Gynae Society, Maharashtra Chapter of ISAR, founder of chair of Indian SIG American Society of Reproductive Medicine, then received 60 awards, including MOGS and BM Award 2017, Connoguel Community Service and National IMA Award, then Lifetime Achievement Award, Honorary FRCG Fellowship, then Imphal Lifetime Achievement Award, Eminent Physician Award, and delivered 700 lectures plus 20 plus oration, many research papers, editor of 18 books and author of numerous national and international publications. Thank you. And lastly, sir, we are hoping to get the future and the FIGO president in the future. Thank you, sir. You can start your talk.
Thank you, Dr. Datta, and all of the chairmen. And I would like to thank the Imphal Society, the president, the secretary, the two joint organizing secretaries, and the president, and all the team. You can see them yesterday. I was there with them and had a great time in the evening, and really impressed by the society. And I'm very happy. This is the last. We have done 33 conferences, and this is the last conference. It is the exit, you understand, and it's the completion of my year, and I really fondly will take a lot of good memories from this conference and cherish them for years to come. So I'm going to talk to you about artificial intelligence, and you must know what is the term called femtech. Now, the femtech term is quite a young term, just 4-5 years old, and it is digital health technologies which can revolutionize patient care and improve outcomes. And it can help healthcare providers deliver more personalized and effective care. So there are a lot of applications of femtech. You have digital marketing, which is now commonly used. You have counseling, you can use it, telemedicine facilities and counsel patients and connect patients to doctors. You have apps such as menstrual app, fertility prediction app, ovulation and pregnancy tracking app, etc., which can track the various things. Then you have wearable devices. You need to have some parameters. You need to take and analyze and give results. So you can have a device that can record your temperature, respiration, heart rate, fetal heart rate. You have electronic medical records. Cervical examination and screening can be done using technology now. 3D and 4D ultrasound imaging, surgery, like you can use it in robotics, big data. And then you have other things like fertility and menopause testing, diagnosing anxiety and depression when your patients go through mental problems. Contraception and pregnancy care, we are developing an app just now which can help enable patients in different languages. We are using the app which can enable patients to decide which contraceptive that they can go for based on their phone. They can just go on clicking and talking to the app, and the app will tell them at that key, this is ideal for you to have a contraceptive usage. And then you have artificial intelligence. So artificial intelligence is a part of the femtech, overall femtech application, and AI at present is very aggressively used in IVF area, antenatal care and labor, oncology and genetics. So I'm going to talk on these 4 areas of artificial intelligence in obstetrics and gynecology. So what is artificial intelligence? It is, so human intelligence has got 2 parts. One is the general intelligence, that is standard AI, which is mainly concerned with cognitive learning and problem solving, and biological intelligence with consciousness, emotions. And machines with artificial intelligence does not possess the biological intelligence. So natural intelligence displayed by humans and animals, that is consciousness and emotions, is not there in the machines, and that is why so machines are artificial intelligence but without consciousness and emotions. And when are going to machines develop the emotions? When will the machines cry? So in 2018, futurist Martin Ford asked 23 leading experts in the field of AI as to when will AI achieve artificial general intelligence. And the average answer was that by 3000 we will have machines which will start crying, which will be jealous of each other's success, etc. Just like humans are jealous of each other, they are appreciative of each other, they have got emotions. So machine will start developing those parameters by 3000. Historically, artificial intelligence was coined by John McCarthy and Marvin Minsky in 1956 in a conference in Dartmouth. And it came into public focus in 1997 when Gary Kasparov, the world chess champion, was defeated by the IBM Deep Blue computer in a chess. It was a big computer. That time, the machines were very large, but we never thought that Gary Kasparov will be beaten. And then suddenly people woke up, this is a big breakthrough in artificial intelligence. So there are various applications of artificial intelligence. One is automated reasoning, knowledge representation, that is having a dialogue in a natural language. This is a very big thing. So, just now I gave a oration in Varda, and the government of India, all over 780 medical colleges have now been recognized internationally. And a time will come now, our graduate can go and work anywhere in the world. Because of the international recognition, you will not have to go through multiple exams. And you just need a language processor. So you talk in your own language and the patient will listen in his language. And when a patient talks in his language, you will listen in your language. So you don't have to actually know the language of the country. So in the future, a lot of our people will be, they will export themselves to other countries for job work. Then automated planning, that is unmanned vehicles, machine ability, natural language processing, machine perception. Machine can have vision, touch, olfaction and hearing, and machine learning. So these are the 8 aspects of artificial intelligence. The last aspect is the one that we are commonly using in medicine. So machine learning is the study of computer algorithms that improve automatically through experience. The machine learns as it goes along. So a standard computer doesn't have the ability to evolve itself. It is a standard computer. With AI program, the computer will start learning on its own and come to conclusions on its own. Hello? So machine learning can be of 2 types. One is form of, so it is achieved through supervised learning and unsupervised. So there are 2 types of machine learning. One is, suppose there is an elephant. You show the photo to the elephant and you say, okay, machine, this is an elephant. So machine will remember, okay, this kind of photo means an elephant. There is another unsupervised learning, means machine will break up the photo of the elephant into multiple parts. It will have a trunk, it will have the ears, etc. So based on the tail, the size of the body, and that the machine will ultimately conclude that there is an elephant. So these are the 2 ways in which the machine learns, and the power of machine learning is in the unsupervised learning. So the unsupervised learning is where the machine becomes more and more powerful using artificial intelligence. So what are the techniques of machine learning? There are 5 techniques of machine learning. Logistic regression, random forest, nice Bayes classifier, support vector machines, and the final technique, which is the artificial neural network, which is commonly used by medical artificial intelligence systems, which includes a recently developed deep neural network. So what is an artificial neural network? It's like a brain network, but it's not actually a network. It is a virtual network. So multiple components and multiple cloud computing systems, they project a virtual brain neural network, and as the intensity of the network increases, the grading of the artificial intelligence goes up. So we have the standard neural network, which typically consists of several layers of artificial neurons fully connected to each other by edges. Each one is associated with a weight. Each neuron receives signals from multiple neurons in the previous layer, integrates those signals and fires if the integrated signals are above a specific threshold. As the number of or the intensity of networking goes up, if you go to deep neural network, then above it is the convoluted neural network, which is called a CNN, and that CNN is the one which we use in our standard AI in medicine. But for this you need programs. So there are a lot of programs that are freely available. They are even free to the people. You don't have to pay for it. We have got the TensorFlow program from Google, or you have got the PyTorch program from Facebook. So in medical administration, you can use artificial intelligence a lot. Electronic medical records, minimizing patient stress and increasing clinical efficiencies, uniform work distribution. There are, of course, if you have a huge clinic with, let's say, 200 IVF cycles going on, machine will distribute the cycles so that every day you do 10 patients. So automatic distribution of starting the cycle. There's a big paper that has come from United States. Stop taking an inventory. Suppose something is expiring, the medicine, automatically machine will tell you which medicine is expiring so that you can replenish the medicine, or your license of PNDT is expiring. Nowadays we put on the machine, I tell them 3 months before you please put a placard, otherwise we'll forget the date and we'll have a problem with the AMO. Machine will tell you automatically 5 months before. SMS will keep on coming to your phone, no, your license is expiring, please note. So that will, then quality control and quality assurance and data analysis. So all this Cochrane review, all that will go away. Automatic data input and the machine will give you the review. All the reviewers, everything, automatic data analysis will be done. So coming to AI in clinical OBGYN, what are these applications? There are 4 main areas: cervical and ovarian cancer, obstetrics, infertility, and something called precision medicine. So remember that for AI to operate, it has to have an input. Data has to be fed in. So what is the input? Images and videos of uterus and adnexa using ultrasound, MRI, CT scan, colposcopy, images and videos or heat maps of sperms, oocytes, embryos, pap smear, cervical cells, photographs, stored image bank. So there is something called ImageNet. So in our, like in internet, there are 2 types of people. One are there who want to make money out of internet, but there is another mad people on the internet. They are free. They don't want any money. They just want to share knowledge, and they are the ones because of which internet has thrived so much, because of which science has thrived. I remember that I got trained in FOGSI in Aarschot in Belgium, and in 1995 they did the first workshop. I had gone and attended it, then I came back and bought a FOGSI machine. So after 10 years, one of the people from Aarschot had come. I said, sir, had you patented FOGSI, how much money you would have made? He said, we don't believe in patenting medical knowledge. So that is the thing. So those people who never patented the knowledge, they are the great people. They made the enabled knowledge to be spread all over the world, so that all rich and the poor people can get access to knowledge. So I am totally, of course, patents are needed for developing newer technologies. You need the money, but I am against major patenting of knowledge. Coming to other data inputs, CTG, umbilical cord blood gases, contractions, part of it. Suppose you want to make an AI model for deciding whether this patient should have cesarean or vaginal birth. So you need CTG information, umbilical cord blood gases, contractions, and part of it. Automatic input, machine will analyze it and compare it to the data and give you the answer. Oh, this patient has to go for cesarean, this patient has to go for vaginal birth. So hormones, tumor markers, temperature charge, blood biochemistry, and then ultimately genetic studies, patient DNA, and you can do HPV virus analysis and big data. All these are data inputs. So what I was telling you, that ImageNet, that is 14 million images. So many people, they just go on uploading images on ImageNet. It is free. You just add to the data bank. So if you want to have an artificial intelligence, many of these data guys will go to the ImageNet and pull out the images. And based on the images, they'll make the AI program. So of course, they'll also take the real-time data. So this ImageNet is a great boon, and as every day, every second, people are uploading more and more information in the ImageNet network. At present, there are 14 million images in the ImageNet network, which are free to utilize. You can use them for your own program. So in cervical cancer, you can do early detection, staging of the cancer, early accurate treatment, and patient will ask, doctor, what is the 5-year survival? My wife has got cancer, you have operated her. What is the 5-year survival rate? So various AI programs are there. You input the data, age of the patient, staging, automatically the machine will give you the prediction of the survival rate. So you can also use cervical cytology. So imagine we are promoting healthcare to everyone. Just imagine if all patients start coming to your clinic and do pap smear, what will happen to your pap smear facility? The the technician will run away. They'll say, doctor, I can't read so many parameters. Machine automatically reads now. And there are a lot of programs that have shown that the accuracy of the machine is better than that of the human. So automatic analysis of pap smear slides automatically will go and read accurately. You know, to give you an anecdotal thing, in our Mumbai city, there is a lady. She is the ultimate authority. You do a biopsy, ovarian tumor, whether it is cancer or not. I had a thyroidectomy. The slide was sent to her. कि डॉक्टर पाई का goiter में cancer है कि नहीं. For 3 days I was tense. I was waiting for her phone call. She said no cancer. So I was very happy. So imagine, on one woman in India, the whole people depend on her for deciding whether it is cancer or non-cancer. This will be taken over by the AI. The AI will tell you using the slide that you have cancer or you don't have cancer, because there can be error in reading that, especially in borderline cases. There can be an error, and that error can decide the outcome of a patient. So that analysis will be taken over by, you can also do AI in ovarian cancer prediction. You know, there is a paper which has done, there's a lot of studies on ovarian cancer. Coming to our obstetrics, so you can do prenatal screening and diagnosis. So you can do improvement in images and automation of measurements. Automatic, you just sweep and machine will tell you the data, age, of everything will just one sweep, and automatic analysis will be done. Risk prediction can be done, ANC prediction of diabetes, PIH, and early personalized intervention. Decision support, AI support can help healthcare workers make more informed decisions regarding medication and intervention in antenatal care and intranatal care. What about ultrasound, probe guidance, image optimization, biometry plane finder, anomaly scan completeness, full fetal echo, placental volume, everything automated. In fact, one of my, many years back, this is about 8 years back, one of my friends who is was in the inner circle of the government, the whole government ministry had gone to Israel at that time, and they had shown that the CT MRI totally will be taken over by the machine. Means reading. In fact, the associations are not happy about it, the radiological association, but at some point machine will fully take over the diagnosis of the radiology department, except they will have to of course sign. Some human has to take the responsibility. Someone has to be prosecuted if there is a wrong diagnosis. So that is the role of a human being at present. The rest of it, the machine. You can't prosecute a machine, I suppose. So coming to AI in intrapartum obstetrics, enhancing electronic fetal heart rate monitoring, ECG, station you can do, help identifying early signs of fetal distress and reduce false alarm, used for labor management and progress, read and analyze text, notes, drugs using natural language processing. You can just talk and automatic processing will be done. Station is this. In fact, 4-5 months back, I had a phone call from USA. They have got some program where you just put 2 transducers on the hand of, and any healthcare worker can do the PV, and it is automatically machine will tell you what is the dilatation station, everything by using the 2 transducers. And automatic AI system will be used for analysis of the, whether the progress is there of labor or not. So all these things are coming. What about intrapartum obstetrics? AI in early diagnosis of patients going for preterm birth. So already this time when Tim Drecker had come last time, he showed me a program which can predict preterm birth. Who will go for preterm birth? Inputting the parameters, because preterm birth identification is a big thing. If we can identify those patients of high risk who will go for preterm birth, and we can give them bed rest and do intervention that can be very good in improving the MMR and perinatal mortality. So preterm birth prediction, classifying vaginal birth, this will 100% come. Utilizing so many new studies have come which have shown, the last study by Fernandez in 2022 has shown a 90% accuracy in predicting mode of delivery using machine learning analysis of 48 attributes. So 48 parameter input you do, machine will, and tomorrow you can say, Baba, humko nahi mano. Machine bola tha ki delivery cesarean karo. So you push it to the machine. So that can be used as a defense by us saying that no machine. So machine cannot be challenged. So the only thing the government will have to decide, because what has happened in the field of AI, there is a huge lot of companies are coming up. Which companies program we will buy? which company's program will buy, and then implement it all over the country as a singular program. So that is the problem. There's too much of companies with too many programs that are available. Then of course coming to my specialty area, that is reproductive, and why I took the subject of artificial intelligence, because I don't like to talk about subjects which I don't work in. I don't like it. I don't like to do theoretical talking. So this is my area. I have used artificial intelligence in my practice since 2019. Since the COVID started, I started implementing AI programs in our IVF lab. So there is this program which can predict ovulation and also predict, see, most of the IVF lab nowadays do frozen embryo transfers. So there's a person who contacted me from Sheba Hospital in Israel. They have done 50,000 embryo transfers, and they can predict the day of the transfer. And they said, Dr. Pai, I said, how much money you will charge me? They said, we'll charge you $40 per patient. $40 is 3,000 rupees. But sir, your pregnancy rate will go up by 10%. You have to just give us the blood report on day 8 estrogen and progesterone, and automatically I will tell you which day you must do the transfer. I said, but my estrogen progesterone may be different from, said no, in the first 8 reports we will exactly analyze, and the AI will pick up the machine which you are using, it will put it in the data. Okay, Dr. Pai's report, automatically that machine data will be looked at and will give you the exact prediction. Only problem was that I keep on traveling. As FOGSI president, I keep on traveling, so I adjust my timing of the transfer based on my convenience. Now that I will not be able to do, because machine will tell me, no, this date you must have done the transfer. If I use that program, so I said, no, forget the program, I don't want. But that program is already available to us. You can also identify anomalies. The new machine I saw just now, just sweep everything, classification, everything. It tells you European classification, is there a uterus anomaly, is there a fibroid dimension, everything. You don't have to measure anything. Another application is in the infertility workup, is the evaluation of endometrium, contours of the uterus, automatic analysis, automatic assessment. There is a new program from IIT. This lady came and met me, said, Dr. Pai, I have this program, you will have to pay 1,500 rupees. Automatic machine will tell you how much gonadotropin to use during stimulation to get the best outcome. We have actually bought the program. So we are starting to incorporate it in our IVF stimulation protocol. So machine tells you based on automatic analysis how much gonadotropin to give, when to do the pickup, when to give the HCG, etc. And you can do receptive analysis. The other thing the AI is doing is in oocyte. So this is the artificial intelligence program for egg analysis. And what happened is that in 2019, I was surfing the LinkedIn, and one of my friends, Alison Rutherford from Care Clinic, wrote on the net that I am using this new program for predicting oocyte quality. So I wrote to her on LinkedIn, and I got the address from Canada. So this is the program from Canada. So what we do is the patient that come to us for egg freezing, we can't predict how many times how many eggs we should freeze. So normally we freeze about 10 to 12 eggs to give her a good chance of pregnancy in the future. But it's all big. So now in this program, you can take the photos of the egg, you export them to the server in Canada. It's called the Violet program. And automatically the server tells that, okay, these 7 eggs that you have frozen are good enough for a good chance of pregnancy 10 years down the line. The program tells you. So if the program says, no, Violet is saying that the chance is less, I show them the program, say Violet is saying that chance is less. You may have to go for one more cycle. So to freeze additional oocytes so that you can have a good chance of pregnancy. So utilizing the Violet program, we can use, and we also have another program which is called a Magenta. So there are a lot of patients that come to us for poor response. They are poor responder patients. They may get 2 eggs, 3 eggs, and the embryo quality is very bad. Then patient get very angry. Oh, Dr. Pai, if eggs didn't fertilize, you must have done something wrong. Why my eggs are not fertilized? Why my embryos are not good? Then using the Magenta, we can counsel them. See, Magenta told that the eggs were not good. The fertilization didn't take place. So utilizing the artificial intelligence program, we can counsel the patients for our failure. The patients start believing because it's more scientific. When I tell them something, they start blaming me because till the outcomes are good, patients are happy. But if the outcomes are bad, the patient will start blaming you. No doctor, you didn't give the injection on time, you didn't talk to me properly, you didn't counsel me well. So this is the, AI can also see, this is how we do the image analysis. We take the photos and we export it, and the server, 2 minutes it takes. That in 2 minutes we get the report generation. This protocol costs me $300. That is about 24,000 rupees. But I give it to each and every patient of mine. All my patients of egg freezing automatically get this program as a part of the egg freezing protocol, because it helps us in doing long-term, support to the patient. You can also identify embryos. So, if you see, the problem in the world is that they want single embryo transfer, because if you do double transfer, the pregnancy rate goes up, but multiple pregnancy rate goes up with the problem of preterm birth, deafness, cerebral palsy, blindness. So in the world, suppose your unit does IVF, and if the multiple pregnancy rate is high, your registration is suspended nowadays. Licenses are removed. People in Europe, for a preterm birth to be managed, the government pays for everything. It costs 100,000 euros. It's unacceptable. So everyone is chabuk, single transfer, do multiple single transfer, but no double transfer. So now the programs are focused. What is the way to improve? Suppose there are 4 blastocysts. I have to only transfer 1. What is the way to give the best chance of pregnancy by putting 1 embryo back? Because I don't want preterm birth. And so there are, of course, the best way is to do a biopsy of the trophectoderm, do the genetic analysis, but it's an invasive procedure. Now, the new technology has come. You just take the photograph of the blastocyst and it predicts whether you will get a pregnancy or not with the blastocyst. Not only that, there is another program which I have not taken because I am a little scared, because in India we don't know PNT. You will say, what is this? You are infringing that. There is another program the company has given where it gives you euploid status also. It predicts whether that embryo is genetically normal. 95% cost is, how much? 10,000 rupees. We offer it to all our patients now. They can select the embryo and transfer it back. So this kind of level of, you just take the photograph of the embryo and you just send it back. There's another also AI which we use in our lab, which is called time-lapse video. So it's a lovely machine. So it takes the embryos are getting cultured, it takes the photographs every 15 minutes, the video is taken, and then that video is analyzed using AI and grading is done. It's so wonderful. I can automatically grade. See, most of the other programs, they grade day 5 embryo. Blastocysts are great. But this machine grades day 3 embryo also. So I don't have to go till day 5. I can do a day 5 grading, day 3 grading, select the best embryo and transfer. Because there's a lot of controversy of putting blastocysts back. Long-term issues are there. There are some papers that have shown higher incidence of malignancy, some papers that have shown larger for birth date babies, and also there's a lot of people who feel that you should do a day 3 transfer rather than a day 5 transfer. So this is a good program to predict. So you can also use AI for miscarriage prediction. You can also do automatic analysis. As you are doing ICSI, this program is there that has come from Mexico. It tells you which sperm to pick up. It just looks at the morphology and the motility of the sperm and says, okay, this sperm is genetically normal. And it tells the embryologist as he's injecting, and it not only does that, it gives them grading, A, B, C grade. So you can pick up the A graded sperm automatically. So you can do the grading. As they are moving, the machine is grading them and it sends the information back to you and you can pick up. The other thing is, so ultimately all this is, the vision is personalized medicine. You can do a DNA profiling using NGS and using multiple variables. You can predict. For example, I may be having good effect with crocin if I have pain. Someone may be better with brufen. And the side effect, my body may be, based on my DNA profile, I may have a bad side effect with crocin. With paracetamol, while the other person may have a bad side effect with brufen. So personalized medicine. The GP will take your DNA profile, put it in his computer, automatically AI will tell the symptoms, you will input them and they will say this is the medicine you give, interaction. So in the future, personalized medicine is going to be, and every one of us will have a DNA profile. Everyone, like Aadhaar card, you will carry your DNA profile also on your card, which can be, suppose you have an accident on the road, अरे कौन है ये डॉग, कौन नहीं, ठक करके DNA profile डाल दिया, automatic will come. This man is from Mumbai, he was traveling, his blood profile is there, his DNA profile, automatic tracking of the patient will be done. So there's something called OpenAI. What is Chat GPT, which is, what is Chat GPT? Generative pre-trained transformer, it is known as. And it's a chatbot and it can do almost everything that a human can do. Language processing, conversation, emails, blogs, text, office work, research, programming, translation, continuous client support. But the information is still 2021. And every time nowadays I'm a bit busy, but nowadays before I do anything, I put it in the Chat GPT to see whether I missed out anything. So recently I had to give a presentation to one of the WHO forums, 3 months back, and I wrote my presentation. Then I told my CEO Ojaswini, I said, Ojaswini, just check Chat GPT, what is there anything left? So I had only written 20%. Chat GPT gave me 80% more information which I had forgotten to write. I said, हाँ ये भी बराबर है, ये भी बराबर है. So using Chat GPT information, I modified my presentation. So that is but you can't depend on it. You must source it. Suppose Chat GPT tells you this, you need to go back to the Google and search because it can give you inaccurate information. So AI has a lot of advantages. It is as good or better in diagnosing breast cancers, melanomas. Language translation can even deliver. So I told you, you can go anywhere. You can go to Spain and do your medical practice using a language translator. Can improve customer satisfaction through content, messaging, ads and recommendation. Greater in data-heavy industries such as pharma, banking, insurance, serves labor by automation and increases production. AI virtual agents are always available, no sleep, eat. Secretary will go do gadbad, take holidays, machine will not. Ultimately, all your secretaries will be replaced by AI. But deep fakes, privacy infringement, data protection, cyber security, lack of standardization, data biases, small number of data sets. So a lot of problems are there with AI. But there are a lot of solutions also. So I don't want to go into that. But Stephen Hawking, who was a leading scientist in the world, they used to call him Einstein only of the present century. He said that AI will spell the doom of the humans. Once humans develop AI, AI will take off in its own and redesign itself at an ever increasing rate. Humans who are limited by slow biological evolution will be unable to compete and would be superseded by machine. And that's why there's a lot of now. But we can't see, look at technology, it keeps on evolving. Cars became trains, planes, space shuttle, and now maybe we'll go to time travel. Or in our own line, vaginal delivery came, then forceps came, then cesarean came, then CTG monitoring came. Then we may have the baby outside the body, it is called exogenesis. Or if you look at surgery, vaginal surgery came, then laparotomy, laparoscopy, robotic surgery. And now one day voice control, I always, when I'm doing laparoscopic surgery, I ask my laparoscopic surgeon, he's operating, then I say, Arey jara udhar ye karo, vaisa karo, jara kam karo. So I keep on controlling it. Now, at some point, I will have a robot which will go in and I can talk to the robot and say, Arey jara kam karo jara. Robot, just, I may call him Mickey or something, I can give a word to my robot and say, Mickey, don't operate so much, just reduce it a little. So, I can control it. So, AI cannot be stopped. We have to guide, control and regulate the future AI. And that's why the group of eminent people like Peter Thiel of PayPal, Jeff Bezos of Amazon and Elon Musk of Tesla have committed $1 billion and more money and more government intervention is coming. So in conclusion, over the last 3 to 5 years, we have witnessed increasingly utility and exciting applications of AI in OBGYN, especially in obstetric, cancer and reproductive medicine. Artificial intelligence will usher in a new era of standardization, automatization and precision, leading to personalized medicine. AI-driven approaches are likely to be more objective, more rapid, more importantly, more accurate. And wider use of AI precisely assessing patient characteristics such as ovarian reserve, age, endocrine status, clinical diagnostic tests will undoubtedly increase the efficacy of diagnosis and treatments of all reproductive diseases. So this is the person who had quadriplegia, and then they implanted the chip in his brain and put the electrodes in his arm, and using his thought, utilizing the chip just by saying move my right arm, using his thought he's been able to move his arm. That is the power of AI. You understand it? And so I will conclude by saying that the future of mankind is in the integration of the atom. We need to have the atom, nuclear energy, fusion energy, green energy, hydrogen energy is very going to be important. The gene is important. I told you NGS. Everyone of us will have a DNA profile, precision medicine. The byte, computer is the master. Based on the computer, we can do cloud computing and the space. Ultimately, I feel that our country, our world has to go to the next level because we have a constant mass. If we have to break that system, I always feel, the other day I was sitting in my room and I said, if I go to Wasabi and have a dish of 2000 rupees, for that nearly 50 people have to starve. Then I can have that dish. So there is a constant. If we are happy, there are thousands of people who are unhappy. There is a constant. If we have to break this constant, we will have to go out to the next phase. We will have to go to Mars to break this constant, because ultimately I feel the world has to be ideal, real world in the future. If we can make everyone happy, that will be a fantastic thing, isn't it? Thank you very much.
Thank you, Rishi. It is an excellent presentation, and I hope so in future it will come and do it. So thank you very much.
Thank you.
Next, I probably present the most wanted person in the FOGSI, the scientist of FOGSI, and he is none other than Dr. Jaideep Tang. And I feel that we don't need introduction for him, still for our juniors and who has not come across and has not seen. So I would like to read a few about him. He's the Secretary General Federation of and Gynae, FOGSI, President-elect now. He will be handling the next coming years. Then Vice President, Mumbai Obs and Gynae. Then Chair, International Federation of Obstetrics and Gynecology, Working Group of Abortion, Deputy Secretary, Asia Oceania Federation of Obstetrics and Gynecology, ex-Chairman, MTP Committee, Vice President, Forum of Enhancement of Quality in Healthcare, Consultant, Aswini Maternity and Surgical Hospital Center for Endoscopy and IVF, Mumbai, and Consultant, Jupiter Hospital Fertility and IVF Clinic. And he will be thinking about the conservative surgical management in ethnic age. Sir, is it a right topic? It was given some instrumental. So because to me, I have handed over the paper, whereas in the program it is written as the instrumental birth in modern obstetrics. Yes.
Thank you very much, sir, for that very kind and warm introduction. Let me begin by congratulating and thanking the office bearers of FOGSI, led by our dear friend and very dynamic president, Dr. Rishikesh Bhai. Rishikesh, so many congratulations for a fantastic year. And I can assure you that your help, guidance and advice will be very, very valuable throughout not only my tenure, but the tenure of many presidents to follow. So congratulations and thank you again. Dr. Madhuri Patel, the Secretary General, the Vice President in charge of the conference, Dr. Alka Pandey Madam, and all the other office bearers of FOGSI. It is indeed a privilege and a pleasure to be in this conference in Imphal. This is my first visit to Imphal. Basab was telling me that this is his third visit here, and I do hope that I get an opportunity to come back again. And I must really congratulate the Imphal ONG Society for doing such a wonderful job. I know that it's been a fairly rocky ride to reach this conference, but your patience, your perseverance and your sheer courage to pull this off have been quite exemplary. And I must congratulate the organizing chair, Dr. Shubda, Dr. L. Rameshwar Singh, the co-chair, Dr. Pratima, are you here, Pratima? Many congratulations and thank you for all the personal care that you have taken. Dr. Digel, the organizing secretary, Dr. Helen Kamel, the joint secretary, Dr. Trinity, the treasurer, and Dr. R.K. Praneshwari Devi, the registration and reception in charge. I know that there are faces who sit on the dais, but there is a big team working behind the scenes, and let me congratulate each and every one of them for pulling this together. I'm going to speak on instrumental birth in modern obstetrics, and I have divided my presentation into 3 parts. The first part talks about why instrumental vaginal births or instrumental births in general have come under a bit of a shadow, with some cynicism and skepticism surrounding their use. And I think this would really be important if there are any postgraduates here, because I'm sure all of us have had this experience where a patient comes and says, do a cesarean but don't apply a forceps. Kata, chimta mat lagana. And I think there is actually a reason why this happens, and we perhaps need to think of why this happens. We'll then talk a little bit about the technical aspects of instrumental delivery in modern obstetrics. And in the last part, I'll introduce an extremely exciting new innovation, in fact, the first new innovation in instrumental delivery since almost a century, which is really a very long time. So let me start by talking about antecedents and their long shadow. And if you'll excuse the pun, the reason why instrumental deliveries are looked upon with a little suspicion and cynicism is perhaps because of the way they were introduced to the world. The Chamberlain family, a very well-known family of what was then called accoucheurs in the UK, actually invented the obstetric forceps. Unfortunately, they decided to keep it as a secret. And they kept it as a secret for close to a century, which is a really long time. And because they kept it as a secret, the birth of instrumental vaginal delivery was cast in a shadow. If you look at this statement from the College of Physicians in 1634, they wrote, to give you his character duly complete, he's a doctor, projector, man, midwife and cheat, for he delivered none without the use of instruments by extraordinary violence and desperate occasions which women never practiced or desired. So even before instrumental vaginal delivery became widely available, it was already starting off on a bad note, on a discredited note. In fact, Sir Thomas Jeffcoat wrote, the invention of forceps was probably the most important event in the history of obstetrics, but it was also the first serious incursion of the medical profession into the realms of midwifery, and it became hated by the midwives who did everything possible to discredit it in the eyes of parturient women. Now, one way in which the credibility of instrumental delivery could have been restored would have been through good evidence. And we therefore need to look at the evidence which surrounds instrumental delivery, and not surprisingly, there is a singular lack of uniformity around the evidence which surrounds instrumental delivery. Consider the fact that Sir Kedarnath Das, after 12 years of research and going through approximately 2,000 references, identified more than 550 varieties of forceps. And this creates a problem with evidence, because evidence demands standardization. If you have 550 varieties of forceps, how can you extrapolate the outcomes from one kind of forceps to the other kind of forceps? In fact, he wrote, and I like this sentence, in the 19th century it seemed that any obstetrician on note and some of little note designed their own forceps seeking eponymous fame. There is also the problem that besides this large variety of instruments that were available, the goalposts for when to apply the obstetric forceps kept on changing. You have now the WHO definition, which says you need to wait for almost 2 hours in a primary before you can apply this instrumental delivery. So the argument can be made that the previous evidence was when second stage needed to be applied after an hour. Now it is after 2 hours. Now how can you compare outcomes? Is the poor outcome or a good outcome because you applied the forceps, or is it simply because you waited for a longer or a shorter time? And therefore, because of all these reasons, it led Barbara Harper to say, we used to see birth as a miracle and only mess with it if there's a problem. Now we see birth as a problem, and if we don't mess with it, it's a miracle. It sounds very funny, but for me this is an extraordinarily problematic statement because it makes light of the issues which surround the issues around vaginal birth. Having established why instrumental deliveries are looked upon with cynicism and skepticism, birth in infamy, discrediting by the cadre of midwives who were present at that time, a lack of evidence, we'll now move on to the technical aspects of instrumental delivery. Besides indications, it is in this instance more important to know what the contraindications are, and these are some very important contraindications where you should not apply an instrument. For example, definite cephalopelvic disproportion, high station, cervix is not fully dilated, and some fetal disorders. Going forward, I will have to make a confession here that I am almost completely someone who uses the obstetric forceps. The last time I used a vacuum to deliver a baby was perhaps in 2002 or something. So for over 20 years, I have now not used a vacuum, and therefore a lot of my attention will actually focus on the forceps. You may wonder why this is so. This is so because my dad, my father, who was an obstetrician, was also an obstetric forceps man who did not have much place for the vacuum in practice. Let me reiterate, however, that although I may be someone who uses the forceps almost exclusively, it's not to say that the vacuum is bad. Both are equally good. It depends on your preference. If you look at the indications that have been given in all the guidelines, I feel that there is a bit of a matter of semantics as far as this indication goes. For example, the first sentence says there is no place for a purely prophylactic instrumental delivery, and the immediate next sentence says the standard indication of expediting delivery has stood the test of time. What really is the difference between these two things? It's just a matter of words or semantics. The indication is the influence of the choice of instrument only in terms of avoiding the ventouse in preterm gestation. Otherwise, there's pretty much no difference in the indications if you regard the contraindications. So these are all the classifications for operative vaginal delivery. The Royal College has a different classification of outlet, low, mid and high. And the American College is outlet, low and mid. They don't even consider including a high forceps anymore because nobody really applies them. I would have to say that in current practice, you would usually apply an outlet or a low forceps and some inadvertent mid-cavity forceps. There is a situation where in the second stage has gone on for a while, there's a significant caput which has taken place, significant molding. You can't really make out the station very well, but you apply the forceps, it fits, so you pull the baby out, and while pulling the baby out, you realize that you have actually inadvertently applied a mid-cavity forceps. And that's why I don't think we actually do intentional mid-cavity forceps anymore. We do mainly outlet and low forceps. But I'd like to talk about one more thing which we perhaps should consider, and this is quite important when you are a little junior. It is the non-technical skills for instrumental delivery. When you go to apply a forceps or a vacuum, it's typically a moment of a bit of a high drama. The patient has been waiting for a while for a delivery. Everybody in the labor room, the nurses, the paramedics, they are all waiting. The obstetrician will come and apply, and then you go in. And when you go in, I think you need to project this air of calm and confidence. It's very crucial to change the atmosphere in the labor room to one where you show that you are under control. I really couldn't find a very good English word for it, but I found a good Hindi word for it, and that word is ठहराव. You need to go in there, you need to stand in front of the patient's perineum, and you need to project a sense of authority, of calm and confidence that you will be able to do. You may think that it's a small thing, but I can tell you that if you just pause for a minute before you apply the instrument, reassure the patient, reassure the staff that this is fine, it's under control, it will make a definite difference in the way the patient will cooperate with you. And for that, you need to have good cognitive skills, you need to have some situational awareness and so on. So before you apply your instrumental vaginal delivery instrument, you need to at least make sure that the head is no more than 1/5 palpable. You need to assess the pelvis, reassess the pelvis, make sure that it's adequate, because once the head comes down in the second stage, the assessment of cephalopelvic disproportion can change. You must always empty the bladder, and I don't like to leave an indwelling catheter. I would prefer to put in a normal sialistic catheter. I then remove it and then I apply the forceps. There are some who think that put in a Foley so you don't have to recatheterize after the delivery. I'm not really very fond of that, because I think it traumatizes the urethra when the baby is being born if you leave the Foley inside. So once you have taken care of all this, then the next question is, should you give an episiotomy? I know that anywhere, it is just something I've learned over the years of 20, 30 years of delivering babies. A non-rotational low pelvic and lift out have a low probability of failure, and we don't take patients to the operation theatre when I'm confident that I'll be able to do a delivery in a single pull. Moving on then to the delivery itself. We always like to think that we are doing a cephalic application. That means the blades are properly proportioned and they are fitting properly around the biparietal diameter. But the truth is, most of us do pelvic applications. And it just turns out that now we have applied it in a cephalic fashion. If it is an occipito anterior, the blades will naturally coincide. But remember and always keep this in mind, that the blades will naturally coincide also in occipito posterior position. Always keep that in mind, because the direction of the pull that you need to apply in an occipito posterior is very different than the direction of the pull that you need to apply in an occipito anterior. There is this very, very interesting study. This came a little late, but it told me why crossed forceps perhaps will slowly be phased out. A lot of people use crossed forceps, but I've been using the parallel forceps since almost 1998, and I'm really very happy with it. So I'm going to tell you a little bit about it now. If you look at this study, what they did was they looked at the most commonly used crossed forceps, and they found that the distance between the blades of the crossed forceps was actually very small compared to the average biparietal diameter. What this meant was that when you apply a normal crossed forceps, you are causing some amount of fetal head compression. I was a part of this study in Wadia Hospital, which was led by Dr. Daftari sir and Matalya madam, and Nozer was in charge of the study. It was called the Western India Trial, and I really owe this study and Dr. Subhash Nargolkar a lot, because he was the one who introduced the Hayes forceps to this country, and to this day I continue using the Hayes forceps. Why am I so fond of the Hayes forceps? You'll see that over here. The Hayes forceps is a longer forceps than normal, and it's a parallel forceps. Look at the shanks which are in orange over there. You'll see that they are not crossed like that, which is normally the case. So they are parallel forceps, and because they are parallel forceps, the amount of pressure gets relieved. She'll start bleeding a lot from the episiotomy, so we always put in a proper mop, and that does two things. One, it makes sure that you don't forget to suture the episiotomy at the end of the C-section, and sometimes putting the mop elevates the fetal head, and therefore the second stage section becomes a little easier. Ventouse pop-offs do occur, and there are several reasons for it. It's quite important that if the ventouse pops off, you either stop or switch to a forceps. Forceps or vacuum, as I already said, is not really a debate anymore. It's up to individual choice, but there are several myths about the ventouse. You should not apply the ventouse before full dilatation, and it is also a very skilled procedure, unlike the common belief that forceps is more skillful than a ventouse. If you're going to apply instrumental deliveries, you will have at some point complications, although remember the rate of complications is quite low, and for that you will need to make sure that all these 8 elements of documenting an instrumental birth should be fulfilled. In our labor room, this is printed and it's put up next to the labor room cot, so that when we do the instrumental delivery, before we shift the patient out, we make sure that all these elements are captured. I'm going to speak a little bit about something which we do very routinely and which is an instrumental delivery at C-section. In fact, we don't start a C-section till we don't have a forceps, all our instruments. If you look on this side, you'll see in both instances, it's a very large baby and a very high floating head which would otherwise be difficult to deliver. Look on this side first, you'll see I'm applying the blade, and remember there's no hurry. You have 4 minutes after the uterine incision. You apply the blades very nicely and then you apply, make sure that they fit, and you'll again see the asynclitism over there. Rotate. I hope you saw that little rotation to make sure, because remember when you deliver at C-section, you don't deliver in occipito anterior, you deliver in occipito transverse. So your rotation has to take that into account, and then you carefully, patiently bring the baby out, and you don't have to apply fundal. Now if you look on that side, that baby was 4.4 kilos, the one which I'm delivering on that side, and you'll see that it was so big that my forceps blade was not getting applied. So the important thing I want to tell you here is that you don't have to have a crossed forceps blade at C-section to deliver the baby. Even if you use those as vectuses, you will still be able to deliver large babies with very high floating heads, and you'll see that baby coming out. So the last part of the presentation is what I'm really very excited about, and this is the Odon device. We've been hearing about it for a very long time, and it's finally now come to fruition. There is a institution known as MNHI, which is leading the dissemination of the Odon device, and that's me in Paris with the people from MNHI and Tim Draycote, who led the studies on the Odon device, and we went and we got trained on how to use it. We are in the process of working with them to bring the Odon device to India. It's now gone for a CE mark, because before it becomes commercially available, it has to be accredited. It will get the CE mark hopefully in Jan or Feb, and it will get the commercial license in India by the end of perhaps the half of next year. And that is when we will introduce it through FOGSI to all our members. I'd just like to show you an animation to make you understand why this is such a game changer. You apply that plunger and then you put that plastic bag over the baby's head. This plastic bag has an air seal. The blue part that you see is an air seal which encapsulates the baby's area. So now what the baby has is only a plastic bag around the head. There's no real stiff instrument. You remove the plunger and then slowly with gentle movements you just bring the baby out like you would put in a big watermelon in a plastic bag. And it's really a very promising device, and I think it will quite change the way we do instrumental deliveries. Finally, is instrumental delivery a substitute for C-section? Well, unfortunately, to date, there's not a single randomized trial. So, are we talking about a requiem for instrumental delivery? Most certainly not. In fact, with the introduction of the Odon device, I fully expect that the incidence of instrumental deliveries will rise. So, instrumental vaginal deliveries are not going anywhere. The hallmark of labor management should be individualized care with the expectation of a successful and safe vaginal delivery together with the ability to intervene with cesarean if needed. After all, we want to look forward with hope and not backward with regret. Thank you very much.
Thank you, Dr. Tank. I still remember when, we were talking about the Vintus and about the Chamberlain and all. They gave the instruments sacred, and they wanted to show off to the people that when they come for the delivery, they bring a big box just to show off that their instrument is very big. Yeah. And also they also make lots of noise inside the room, so they know what is going on there. They don't know it. Yes. Anyway, it was like taking class in this one teaching forceps delivery, because right from the inception to the most recent development in the instrumental delivery you have talked about, and I'm sure that my students, they have assimilated all those topics which he has mentioned. Thank you very much for the nice you have delivered.
Thank you, President FOGSI, Vice President FOGSI, President-elect FOGSI, for your exceptional presentations. Your insights were truly stimulating and added immense value to the event. I would like to call on stage Dr. Manglem to facilitate Dr. Alka Pandey, Vice President FOGSI. Please come on stage. Next, I would like to call on stage Dr. Dilip Kumar Datta to felicitate Dr. Rishikesh Paisa. Next, I would like to call on stage Dr. N.G. Andrukumar Sensor to felicitate Dr. Jaydeep Tang. Thank you, chairpersons, and thank you to all the orators. We will be now moving on to the inauguration ceremony.
President of FOGSI, Dr. Manipuri Patel as the Secretary General of FOGSI, and Dr. Alka Pandey as the Vice President of FOGSI.
The making of FOGSI East Zonal Conference with Yuva 2023. First time in the history of our state, Manipur, organized by the Imphal Obstetrics and Gynecological Society. The first Imphal Obstetrics and Gynecological Society, or IOGS, was formed 9th April 1979, and 4 NEOGS-CON conferences were organized at Imphal till date. But the FOGSI East Zonal Conference 2023 with Yuva is the first conference at East Zonal level at Imphal, Manipur. The FOGSI East Zonal Conference with Yuva 2023 has 12 ICOG credit points for conference with 4 ICOG credit points for each workshop and 4 MMC credit hours for conference with 1 MMC credit hour for each workshop. The conference has 4 workshops and 2 full-day scientific programs. Executive Committee meeting on February 2022 for conducting the FOGSI East Zonal Conference with Yuva at the Imphal Obstetrics and Gynecological Society office at IMA Building, Lamphelpad, Imphal. March 2022, Executive Committee meet at Department of Obstetrics and Gynecologist for decision of PPT presentation at the AICOG 2022 for conducting the FOGSI East Zonal Conference with Yuva 2023 at Imphal. IOGS in Solidarity for the Doctors, April 2022 at IMA Hall. Visiting our man, Dr. Bidu Mukhi, a senior IOGS member at her residence. Many programs are conducted monthly, and one such program on July 2022. For sending to Jharkhand at East Zonal Conference 2022. The final dates and officially announced for this conference on September 2022 at Jharkhand. School Health Program immediately, September 2022. 28 September 2022 under FOGSI MTP Committee. Fundraising for the upcoming FOGSI East Zonal Conference with Yuva 2023 at IMA Hall by conducting housing among IOGS members was conducted on 23 October 2022 under the President FOGSI and Oncology Committee at JNIMS. Group photo of all the committee members taken on 6 December 2022. IOGS team at AICOG 2023, Kolkata, with President FOGSI Dr. H.D. Pai at AICOG 2023. The 22nd of March 2023, IOGS awarded Appreciation Award. For the first time, IOGS webpage released on the 4th of March 2023. At Patna in the Vice President Dr. Alka Pandey Conference 2023. On the 12th of April 2023, with Dr. Basa Mukherjee, past Vice President FOGSI, giving tips to the IOGS members for the FOGSI East Zonal Conference 2023. At Relief Centers Moiram, on 30th of June 2023, the quiz sub-Zonal was conducted at JNIMS under Dr. Helen, along with the IOGS team. On the 25th of July 2023, pregnancy complications and prevention message through media given. Online conducted due to unfortunate problem at Manipur. FOGSI conducted online competition on the 17th of October 2023. Released on 29th of October 2023. Arrival of conference bags. First CME after the May on 12th of December 2023. Come Executive and Organizing Committee meeting. Finalizing scientific program again and again on 17th of December 2023. Conference preparations in full swing.
Namaskar. Kwaipung namakpu ikok nonjeduna kurumjeri. That was a Manipuri greeting which means I humbly bow down to you in respect. A very good afternoon, esteemed gathering, on this auspicious afternoon of Saturday, the 23rd day of December 2023, we have all gathered together at the heart of Imphal, the capital city of Manipur, to take part in the inaugural ceremony of the momentous FOGSI East Zonal Conference with Yuva 2023. On behalf of the organizing committee of the FOGSI East Zonal Conference with Yuva 2023, I accord a very warm and heartfelt welcome to all the distinguished dignitaries, honored invitees, and valuable participants. May I now take the privilege of inviting the distinguished dignitaries to grace the dais. The chief guest of the inaugural ceremony, Dr. Sapam Ranjan Singh, Honorable Minister, Medical, Health and Family Welfare, Publicity and Information, Manipur, sir. Please give a big hand of welcome. Dr. Rishikesh D. Pai, President FOGSI. May I have the esteemed President FOGSI on stage? May I request the gathering to kindly continue to clap for all our distinguished guests. Dr. Madhuri Patel, Secretary General FOGSI, the guest of honor. Dr. Rishikesh D. Pai will preside over the inaugural ceremony. The guest of honor, Dr. Madhuri Patel, Secretary General FOGSI. Next, I take the pleasure of inviting Professor Dr. G. Sunil Kumar Sharma, Director, Regional Institute of Medical Sciences, Imphal, Manipur. Next, may I take the pleasure of inviting Dr. Alka Pandey, Vice President, East Zone FOGSI, the guest of honor of today's occasion. May I also take the joy of inviting Dr. N. Subodha Singh, Organizing Chairperson of the Organizing Committee of this momentous conference, Dr. K. Pratima, Organizing Secretary, Dr. T.H. Dijel, Secretary, Organizing Committee, Dr. Rajkumari Praneshwari Devi, Chairperson, Reception Committee. May I request all our distinguished dignitaries to kindly grace the dais of today's inaugural ceremony. May I now request the members of IOGS to kindly come up on the dais for the national anthem and the Saraswati Vandana. Saraswati Vandana will be followed by the national anthem. Saraswati Vandana only. Saraswati Vandana only. May I request the esteemed gathering to kindly rise for the Saraswati Vandana.
Ya kunde do tushar har या वीणा वरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करा प्रभृतिभिः देवैः सदा पूजिता सा मां पातु सरस्वती भगवती निःशेषजारापहा शुक्लां ब्रह्म विचारसारपरमा आद्यं जगद्व्यापिनीं वीणापुस्तकधारिणीम् अभयदां जार्यन्धकारापहाम् हस्ते स्फाटिकमालिकां विधाततिं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्।
Please be seated. Thank you so much. The organizing committee will now felicitate the chief guest, president, and guest of honor gracing the dais of today's occasion. May I take the pleasure of inviting Dr. Thangjam Netajini, convener, reception committee, to do the honors of presenting traditional Manipuri Lengyan with the motif of Sangai, the state animal of Manipur, and Rosette. Dr. Thangjam Netajini. It is a tradition in Manipur to accord a very warm and heartfelt welcome with the presentation of the traditional Lengyan. The chief guest, Honorable Minister, Dr. Sapam Ranjan Singh, will now be extended a very heartfelt welcome and appreciation on behalf of the organizing committee. Next, the President of the occasion, Dr. Rishikesh D. Pai, President, FOGSI. Dr. Madhuri Patel, Secretary General, FOGSI, Guest of Honor. Professor Dr. G. Sunil Kumar Sharma, Director of the esteemed Regional Institute of Medical Sciences, Imphal, Manipur. Dr. Alka Pandey, Vice President, East Zone, FOGSI. Dr. N. Suboda Singh, Organizing Chairperson of the Organizing Committee. Dr. K. Pratima, Organizing Secretary. Dr. T.H. Dijel, Secretary, Organizing Committee. And Dr. Rajkumari Praneshwari Devi, Chairperson of the Reception Committee. Thank you so much, Dr. Thangjam Netajini, Convener, Reception Committee, for doing the honors. Dr. Rajkumari Praneshwari Devi is the chairperson of the reception committee. To present the welcome address, may I now request Dr. Rajkumari Praneshwari Devi, chairperson, reception committee.
Namaskar, Khorom Zari. Very good afternoon. Distinguished chief guest, Dr. Sapan Ranjan Singh, Honorable Minister, President of today's function, Dr. Rishikesh Dipai, President of the FOGSI, esteemed guests of honor, Dr. Madhuri Patel, Secretary General of the FOGSI, Professor Dr. G. Sunil Kumar Sharma, Director of RIMS Imphal, and Dr. Alka Pandey, Vice President, East Zone of FOGSI, respected members of the FOGSI, Yuva, and our valued participants. I, on behalf of the organizing committee, would like to extend a warm and heartfelt welcome to our esteemed dignitaries and the respected guests and all the participants who have gathered here from across the region. Our chief guest, Dr. Sapan Ranjan Singh, Honorable Minister of Medical, Health and Family Welfare, Publicity and Information, Manipur. Your presence is immense prestige to this event. We are deeply grateful for your commitment to the improvement of the healthcare and your valuable support of initiatives that promote the well-being of the women and families. Dr. Rishikesh Dipai, President of the FOGSI, your visionary leadership has been a guiding force for the entire obstetrics and gynecology community. Your presence today here is a testament to our dedication and advancing the field and fostering collaboration among the professionals. We are also honored to have with us Dr. Madhuri Patel, Secretary General of the FOGSI, whose tireless efforts contribute significantly to the growth and success of our organization. Thank you for being with us today. Professor Dr. G. Sunil Kumar Sharma, Director of the RIMS Imphal, your expertise and leadership in medical education and healthcare are truly commendable. We are privileged to have you as our guest of honor. Dr. Alka Pandey, Vice President, East Zone, FOGSI, your commitment to the cause of the women's health in the East Zonal is truly admirable. We are grateful for your leadership and the positive impact you bring to our region. The inclusion of Yuva, the youth wing of the FOGSI, as an extra layer of dynamism to our discussions. So it is here heartening to witness the next generation of the medical professionals eager to contribute to the advancement of the obstetrics and gynecology. Once again, a heartfelt welcome to the FOGSI Zonal Conference with Yuva FOGSI 2023. May our time together be enriching and inspiring.
The auspicious moment of the inaugural ceremony now arrives, the lamp lighting ceremony. It is my honor to invite the chief guest, president, and guest of honor of the inaugural ceremony to kindly light the inaugural lamp, invoking the blessings of the Almighty God upon this significant event. The chief guest, Honorable Minister, will lead the lighting of the inaugural lamp, followed by the President and guest of honor. This is a symbolic moment that signifies the dispelling of darkness and igniting of thought and enlightenment. Just as the lamp enlightens the surroundings, may wisdom and awareness shine upon us. May the light of this lamp illuminate our path and guide us towards truth and knowledge. The chief guest, the president and guest of honor, doing the honors of lighting the inaugural lamp of the momentous FOGSI is Zonal Conference with Yuva 2023. Thank you so much to the chief guest, President and guest of honor, for lighting the auspicious lamp of the conference. And now, to present the keynote address, it is my pleasure to invite Dr. N. Subodha Singh, President, IOGS, and Organizing Chairperson of the conference. Ladies and gentlemen, Dr. N. Subodha Singh.
Honorable Minister of Medical Health and Family Welfare, Government of Manipur, and chief guest of today's function, Dr. Sapam Ranjan Singh, President of FOGSI, Dr. Rishikesh Pai, Secretary General, Dr. Madhuri Patel, Vice President East Zone, Dr. Alka Pandey, Director, Regional Institute of Medical Sciences, Professor G. Sunil Kumar Sharma, dignitaries on the dais and off the dais. Then, respected all the faculties and delegates, ladies and gentlemen, today is a very happy and special day for all the members of Imphal Obstetric and Gynecological Society, IOGS, that we have finally realized a long-cherished dream of organizing a FOGSI national event, the FOGSI East Zonal Conference with Yuva 2023. Because of unforeseen and unfortunate circumstances, we had to postpone this conference, this event, which was earliest scheduled in September 2023. But now the situation has slowly come back to normal, and today we hear that everybody will be able to freely move around in all the parts of the state, as it was informed. And I'm sure our Honorable Minister is here, and he will educate us more on this. And I take this opportunity to appreciate the support of our charismatic President, Dr. Rishikesh Pai, who allowed us to reschedule this conference. Credit also goes to our two vibrant and charming ladies, Madam Madhuri Patel and Madam Alka Pandey, who have been helping us out in all difficult times. I'd also like to show my gratitude to our dear and loving previous Vice President, Dr. Vasant Mukherjee, who has been guiding us throughout the preparation of the conference, giving us all very important and useful tips. Imphal Obstetric and Gynecological Society was launched on 15th September 1979 with Professor S.K. Bhattacharya as President, Dr. K.S. Tomba Singh as General Secretary, and Dr. C.S. Manglem Singh as Treasurer, with just 16 members. The first annual scientific conference was held on 10th of February 1982 with the then Chief Minister of Manipur, Sri Rishankar Singh, as the chief guest, and Dr. R.D. Pandit and Dr. S.N. Daftari as guest of honor. In 1983, we received FOGSI President's Best Award for the Best Society for Membership Below 50. In February 1985, at the CME conducted by IOGS, legendary gynecologists of the likes of Professor B.N. Purandre, Professor C.S. Don, and Professor M.N. Parikh attended and gave lectures. In the 44 years since its inception, we have come a long way with almost 200 qualified gynecologists registered in our society today. We have conducted 3 NEO-GSCON, that is Northeast Obs and Gynae Society Conference, successfully so far. Our society and members have been working constantly and participating in almost all FOGSI undertakings towards bringing awareness among the public and for the betterment of women's health in the state and in the region. And I'm sure a conference of this magnitude will help a big way in enhancing scientific knowledge and expertise of all the delegates present and all our members of IOGS. 4 pre-conference workshops on gynae endoscopy, gynae oncology, PPIs, and the research, the big shape, have already been successfully conducted yesterday, and I'm confident all those who participated have been benefited. The theme of the conference, a healthy heart for a healthy life and a healthy woman, was chosen considering the ever-rising non-communicable diseases, especially heart disease among the population in general and the pregnant women in particular. The changing lifestyle and the marriage at older ages have already complicated this matter. So that's how we chose the theme. We have 4 orations, 3 of them have been already delivered by eminent faculties on various important topics and lectures on numerous burning issues by experts in their fields. So I wish all the delegates to have a wonderful learning experience with the deliberations and also enjoy our hospitality during your stay here. Long live IOGS, long live FOGSI. Thank you.
That was a very illuminating keynote address of the conference delivered by Dr. N. Subodha Singh, President of the esteemed IOGS and also the organizing chairman of the conference. Thank you so much, Dr. N. Subodha Singh. Welcome to the little paradise on earth, Manipur. Pandit Jawaharlal Nehru, the late Prime Minister of India, called Manipur the jewel of India. And as a never to be forgotten souvenir of Manipur, the crown jewel of India, and to mark this momentous conference, we shall now present a very valuable memento of the state animal of Manipur called Sangai, the dancing deer, found nowhere else in the world but in the one and floating sanctuary of the world, Kaibul Lamjau. May I now request Dr. Sanaton Hantembi, co-convener, reception committee, to kindly do the honors of presenting this very valuable souvenir to the chief guest, president and guest of honor. The chief guest will now be presented with a memento of Sangai, the state animal of Manipur. The president of the occasion, Dr. Rishikesh D. Pai, President FOGSI. The guest of honor, Dr. Madhuri Patel, Secretary General FOGSI. Professor Dr. G. Sunil Kumar Sharma, Director of the reputed Regional Institute of Medical Sciences, Imphal, Manipur, the guest of honor. To be followed by our guest of honor, Dr. Alka Pandey, Vice President, East Zone, FOGSI. Thank you so much to the co-convener reception committee, Dr. Sanaton Ahantepi, for doing the honors. And now, the release of the souvenir of the FOGSI East Zonal Conference with Yuva 2023. May I once again take the privilege of requesting the chief guest, president and guest of honor to release this significant souvenir. Chief guest, hang door. Please open the packet. Yellow. May I request all the distinguished dignitaries to hold the souvenir in your hands and release it together. Please hold up the souvenir in your hands. Thank you so much. The souvenir of the momentous FOGSI is Zonal Conference with Yuva 2023 has been released by the Chief Guest, President and Guest of Honor. Thank you so much. May I now request the Guest of Honor, Professor G. Sunil Kumar Sharma, Director, Regional Institute of Medical Sciences, Imphal, Manipur, to present a few words. Ladies and gentlemen, Director, RIMS.
Good afternoon to all. Sabko namaskar. Respected Honorable Health Minister of the State, Dr. Sapam Ranjan Singh, Dr. Rishikesh, President FOGSI, Dr. Madhuri Patel, Secretary General FOGSI, Dr. Alka Pandey, Vice President East Zone FOGSI, other respected dignitaries on the dais, also esteemed delegates from all over the country, our respected teachers of the past RIMS of St. Gaidi, all the other faculties of the institute. It is indeed a privilege to be standing here and giving a small speech on this a wonderful event organized by the Imphal of St. Gaidi Association, organizing the East Zonal Conference with Yuva 2023. And what is more exciting here is, this is the first time, as I've been informed, that we are organizing an event of FOGSI in this part of the country. So this is quite a event that will remain as a watershed mark in this history of RIMS Imphal. For this, I congratulate the entire team for bringing this event to this wonderful place. Of St. Gaidi, everyone will agree that is one of the main pillars of medical science, taking care of the human generations. And with advancement of loss of technology, maybe like laparoscopic surgeries or maybe the drugs helping the infertility and so many advancements that we have seen in the last 2 decades, the amount of treatment options available to the patients has increased to a huge, you can say, quantum jump compared to our student times, about 30, 40 years back, 35 years back. So quite a lot of facilities are available to the patients, and that's a very good part. At the same time, the doctors giving the treatment the responsibility of the doctors giving treatment also has increased to the same quantum. And at this point, what type of treatment is the best treatment to be given to that particular patient, the ethical practice will come to play in a very major role as the society gets educated over a period of time as compared to those old days. So ethical practice, we all know, is the gold standard, like what the patient should be getting and the information that a doctor should be giving to the patient also of paramount importance. And the practice of, like, as I've said, the obs and gynae experts are taking care of the human generations. And keeping in that mind, I would like to request everyone, especially the obs and gynae experts, to give the best available treatment to the society, especially Manipur, as I keep on talking about, is a poor society, and the importance of ethical practice and giving the best practice is very important from my point of view. And I have seen the preparation for last 2 days, and I think the organizers have done a wonderful job in preparing this organizing site to a very beautifully place to welcome all the dignitaries from the different parts of the country. And all the workshop themes and also the deliberations and the lectures to be given by the experts will bring a very good amount of knowledge to all the participants. I hope our organizers will be taking care of all the delegates coming down to this place, and I hope all to have a very good, productive session. With that, I wind up my small speech. Thank you all for coming down here. Thank you.
Thank you so much for the brief and meaningful address. Professor G. Sunil Kumar Sharma, Director, Regional Institute of Medical Sciences. It is my honor to invite the guest of honor, Dr. Madhuri Patil, Secretary General, FOGSI, to present a few words on this momentous occasion.
Respected our Chief Guest, Honorable Minister, Medical, Health, Family Welfare, Publicity and Information Manipur, Shri Dr. Sapan Ranjan Singh, our President FOGSI, Dr. Rishikesh Pai, most dynamic and visionary, Professor G. Sunil Kumar Sharma, Director of RIMS, Dr. Jaideep Tang, President-elect FOGSI, Dr. Alka Pandey, Vice President FOGSI, Dr. N. Subodh Singh, President and Organizing Chair of this conference, Professor L. Rameshwar Singh, Co-Chairperson of this conference, Dr. Pratima Devi and Dr. Dijal, Organizing Secretary, Dr. Paneshwari Devi, Dr. Ranjit, all the speakers, chairperson, and all the moderators, panelists, and my dear friends. Very good afternoon to all of you. At the outset, I would like to thank organizing team and our President FOGSI, Rishikesh Pai, for giving me this opportunity. Sir, I would like to mention that FOGSI is having 270 member bodies all over India, and Imphal is one of them. And we are 43,000 members all over India. They are committed to women's health. Let me tell you, we have 2 academic wings. One is called as Indian College of Obstetrician and Gynecologists, and it is called as ICOG, and we are trying to make this, NMC recognized. If possible, this will be biggest thing to happen in our, FOGSI. Secondly, we have a Journal of Obstetric and Gynecology of India, which is known as JOGI. We have bi-monthly issue, so total 6 issues in a year. It is on the digital platform as well as the printed form, and this printed form is delivered all to our 43,000 members free of cost. Because many of the members are not digital savvy, there is internet problem, so at least they read this journal, update their knowledge, which can benefit to our women. We have 2 policies what is called a professional indemnity policy, which is tied up with ICICI Lombard, and Cover You is a third party, and we have social security scheme. So we want to give benefit to the nominees of our members when there is sudden demise occurs. And of course, I would like to mention about the mission of FOGSI. There are many missions, but the primary mission is reduction in maternal mortality rate. Let me share that India has achieved double digit, that is 97 maternal mortality rate per 100,000 live birth. And we all are marching towards our sustainable development goal of MMR less than 70 per 100,000 live birth by 2030. So let me share the few of our states like Kerala, Maharashtra, Andhra Pradesh, Gujarat, Telangana, and I'm happy to share even Manipur has, achieved this target of MMR less than 70 per 100,000 live births. So the states who have achieved this target, I would like them in 7 years by 2030, at least they should reduce MMR to single digit. Now, the states which have not achieved the target, they are marching, our nation is marching towards sustainable development goal of MMR less than 70 by 2030, and we are very sure it will happen. And this is, I congratulate not only the government, but organizations like us, FOGSI, who are into it, and all these grassroots level workers, obstetricians, paramedics, they are doing and they are responsible. They should be given credit for reduction in maternal mortality rate. Now, I would like to also mention that postpartum hemorrhage is one of the cause of highest maternal mortality rate. And we are doing many projects internationally, and our Safe Motherhood Committee, we had yesterday, workshop on that, and we were sensitizing and making aware about these, and our practical obstetric committee, they are doing all this work for the reduction of maternal mortality rate. So as I mentioned, PPH is the highest cause of maternal mortality rate, and we have tied up with our FIGO, Biz Engage, where we are doing leadership development initiative. They want to have the project where the high mortality rate is there, that is in UP and Bihar. We are going along with that, and our 50 young doctors have joined in that. They will give their, input about the PPH management and the iron, parental iron, to reduce the anemia. So all of us are aware that anemia is a major cause of the postpartum hemorrhage, indirectly and directly, and we are working towards it. During our presidential year, Dr. Rishikesh Pai, we had yatra from northeast to the south, again to Kolkata and south, anemia, because the prevalence is still 70%. So what our president and we used to do, in the morning we used to have a community, camp in form of collecting the blood and the other breast and the cervical cancer screening, etc. Evening we used to have a press conference, we used to brief journalists because they are also big people to sensitize our community, and thirdly we used to have a CME with the local bodies, and we used to update them. So this has really given a good impact, and Dr. Rishikesh and myself and team will come out with the big data, because we have already collected blood for so many of our women, and we will give the data in near future. So with this, I would also like to mention that cervical cancer, especially in Northeast, is a big problem, and we have done with FIGO, that is our Federation of International Society of OBGY, we have done that about the HPV screening. And I would like to mention, when last year we had an official meeting with the official of government in AIMS, and that time we could convince our government official to have a HPV vaccine in a national immunization program. So very soon we are going to have indigenous HPV vaccine in National Immunization Program. The another program we are running for this cancer service is with the American Cancer Society, and we are going to train 10,000 gynecologists for this HPV vaccination. We are on our way. We have already trained 2,500. So this is our FOGSI mission, not only academic, but also do the community services and research. And with this, I would like to mention that this Congress which is happening, it is happening, it was postponed September to December. And I should tell the organizing chair and committee, we are going to be there. Whenever you organize, we are going to be here for this conference. And Dr. Subodh, Dr. Pratima, and entire team has kept their promise. It has been happening excellent. I'm there since yesterday. Everything is good. Speakers are, all chairperson, moderator, and panelists are doing excellent work, in updating our knowledge. And with this, I congratulate and I appreciate them for doing the fantastic work. And Dr. Sunil Kumar, I would like to mention, I saw your campus. It is excellent, excellent, and excellent. Please keep it up and in updating your, hospital. With this, I would like to mention the quote by Nelson Mandela. Education is the best weapon. When used, can change the world. So, dear friends, use this education to update our knowledge and give the best to our women's health. Thank you once again for giving me this opportunity.
Thank you so much for the thought-provoking address. Dr. Madhuri Patil, Secretary General of FOGSI. It is our honor to invite Dr. Alka Pandey, Vice President, East Zone FOGSI, the guest of honor of today's occasion, to deliver a few words.
So, dignitaries on the dais, our chief guest, Honorable Minister, Health and Family Planning, Publicity and Information, Dr. Sapan Ranjan Singh Ji, President FOGSI, Dr. Rishikesh Pai, Secretary General FOGSI, Dr. Madhuri Patel, President-elect FOGSI, he has just left, Dr. Jaideep Tang, Director RIMS, Professor G. Sunil Kumar Sharma, Chairperson Reception Committee, Dr. R.K. Praneshwari Devi, Organizing Chairperson and President, Imphal Society, Dr. N. Subodha Singh, Organizing and Co-Chairperson, Dr. Rameshwar Singh, Organizing Secretary, Dr. Pratima and Dr. Dizel, and esteemed delegates present in the hall. A very good afternoon to you all. And today, I am so happy and so delighted to see that the East Zone Yuva FOGSI 2023 has seen light of the day. It has been hosted so wonderfully by the Imphal Society, and I really appreciate the zeal, the enthusiasm, and the perseverance with which you handled the situation. My heartiest congratulations to the organizing team. You have made it in spite of all the adversities, and we are extremely proud of you. I joined as Vice President FOGSI in 2022 October. Since then, I had the opportunity of being closely associated with my President, Dr. Pai, and have been a part of many of his programs. He has created a history by reaching out to all the societies affiliated to FOGSI Pan-India. His slogan is Swasth Nari Sukhi Nari, Ekikaran, Samta and Takniki, and many academic programs including conferences, workshops, karyashalas, webinars with national and international faculties were conducted. Many GCPRs have been released and FOGSI focuses also have been released. Meetings and advocacy with the government and NGOs such as WHO, MSD, Japaigo, Bill Gates and Melinda Foundation, FIGO, and was done, and many projects have been rolled out to reduce the incidence of PPH, anemia, and train the paramedics so as to reduce the MMR of India and reach the target of less than 70 by 2030. Regarding fellowship, Dr. Pai personally went to all the societies of East, West, North and South Zone together with his team. His Nari Swasth Yatra will always be remembered with fond memories. We developed friendship with so many new people. The president and secretaries of the societies, luminaries and legends of FOGSI societies were recognized, appreciated and felicitated. We also had lots of fun with music and dance in all the societies we went. Gender equity run is going on in all the zones of the country, and it will conclude on 3rd of January in New Delhi. Now, during his Nari Swasth Jan Andolan Yatra, anemia camps were held and huge data has been collected, as already told by Dr. Madhuri. It is being analyzed and soon will be published. Many cancer detection camps were organized. Plantation of trees, thousands of trees were planted by the FOGSians all over India under the presidency of Dr. Pai. And he has been very inclusive. He made all the vice presidents, secretary general, chairpersons a part of all his programs, and I'm really proud and fortunate to be his vice president. The secretary general of FOGSI, Dr. Madhuri Patel, is a very dynamic lady, hardworking, soft, caring, and I'm really lucky to have been associated with you, madam. And the thought that this pleasant journey is going to end in Hyderabad in January makes me a little sad. But then this is life, we have to move on. And I wish health, prosperity and success to all of you present in this hall. And once again, congratulations to the Imphal Society for hosting this wonderful conference. Long live FOGSI.
Thank you so much for the encouraging speech. Guest of honor, Dr. Alka Pandey, Vice President, East Zone, FOGSI. Thank you so much, ma'am. I take the unique honor of requesting Dr. Rishikesh D. Pai, President of the illustrious FOGSI, to present the presidential address. Ladies and gentlemen, a big hand of welcome for the President FOGSI.
Thank you, madam. Thank you, everyone. I would like to, first of all, recognize the dignitaries on the dais. Dr. Sapam Ranjan Singh, he is the Honorable Minister, Medical Health and Family Welfare, Publicity and Information, Manipur, and more than that, he is our radiologist friend, he is our fraternity, and it's very proud to have a doctor, being a minister, because it's a very deep connect which we have. And then we have our Madhuri Patel, our Secretary General, and our guest of honor. By the way, Madhuri Patel is our first lady Secretary General. So we are, Modi ji ka jo hai na ki equality of gender equality ekdam जोर में हमारे organization में sir. And then Professor G. Sunil Kumar Sharma, who is our Director of Regional Institute of Medical Sciences, Imphal, and a very dynamic, I know that's a very beautiful institute. Then we have our Dr. Alka Pandey, Vice President, and as you know that we have 5 Vice Presidents. They are all very dynamic. I am really lucky to have Alka ji, very soft, spoken, nice, and everything I have told her she has done, very effectively. So she has been a great leader, and she looks after the whole East Zone, including our 7 sisters. You are a part of those 7 sisters. And then our local people, Professor Dr. N. Subodha Singh, who is our president of the Imphal Society, very important person for me. And then the two secretaries, Dr. Pratima and Dr. Dijal, and Dr. Rameshwari Singh and Dr. Paneshwari Devi, who is also there. And so all of them are very important. The Imphal Society is a part of the big federation. Sir, we have we are like BJP only, the small BJP. We have 270 societies, 41,000 members. You know, it's like a small, party only. But of course, we are a party for health. We don't have I really look up to our Honorable Prime Minister. He's done a lot for women's health in the country. The party has done a fantastic job, and I'm really appreciative of that. Especially a lot of things he has done for maternal health, for women's equality, a lot of things, infrastructure development. I would like to tell you that when I got elected just now in Paris, we have our World Federation, and I got elected. The Indian power has, it's a different, the people, they, first thing they told me, "Arey, ab to Chandra moon pe land ho gaye." And the previous day, the Russian landing had crash landed. So it became more relevant. So the people, they look at us with respect. That is what is very important. And then, of course, there are a lot of people in the audience. So I need to recognize Dr. Indra Kumar and Dr. Manglem Singh, who are my very good friends for many, many years. And of course, Jaideep Tank, our dynamic, I would call him young president, because after me, the next the line is a younger line of president. He unfortunately had to go to catch the flight. And then Dr. D.K. Datta is there, who is from IMA, just walking across, and he's been our past vice president, chair of the ICOG. Dr. Basav is there, who is again our vice president. Priyanku Roy, who is also gone. Priyanku Roy, by the way, is the president of the WATOG, World Association. Already an Indian is the president of the Junior Gynec Association of the world. So you can imagine where our Indians are reaching. And then a lot of people from Nepal. Ashma Rana is there, who is come from Nepal, and Dr. Regina, I see her, the younger version from India, has gone to Nepal, and she is there in the audience. And our chairperson, Dr. J.B. Sharma, one of the giants from the All India Institute, our professor and very respected professor, Dr. J.B. Sharma, and Dr. Savana is there, and many other people are there. So I can't take everyone's name, and I'm really grateful to all of you, because I know that this was a challenge. This is my 33rd conference, sir. This year it has been a fantastic run, because I have been in the organization for 30 plus years as in administrative roles since 1999. And so, by the time this is the last year of mine, as after this I will go to the World Federation. So this was very important, and this particular conference is a very important for me, because it's a statement that kuch bhi hoye to hum karenge hi. And that is the important thing. The Imphal conference was very important for me, and I'm so happy. Among the 33 conferences that I did, this is the most important conference. Because it has something, because we must prevail. For us, India is one, our country is one, and we will not allow any division. And this is symbolic. This represents that integration which we have for each other, the love and affection, and we will mend ourselves and will evolve. So when these people did it, I told my wife, I am going to go all 3 days there. I came on Friday. They said, well, because I always am on the run. But this one particular, in fact, in the morning, I scared Dr. Pratima and told him I am going. But then I said, no, I need to stabilize myself, because it's in my DNA. My DNA is very unstable DNA, and it's always on the run. But I said, no, I must control myself and stay here and take in the last and the final part. Coming to the federation, as I told you, it's a large federation, and what is there? There is limitless. I can imagine, what Mr. Modi ji, hamare jo Prime Minister, unke mind mein kya hoega? Because a lot of people have told me कि he works for 18 hours a day. So I know how much I can work. मैंने इतना छोटा organization में इतना काम किया, तो sir क्या काम करते होंगे? उनके mind में क्या responsibilities होगी? It's like when you lead an organization, you want to do everything possible. You want to do this, that. It's not possible, but we try to do it. And just before I leave, I'll tell you that the association has got 6 pillars which we operate on. One is, of course, academic. Second is the research pillar, which is very good. This time I have done good clinical practice guidelines. For 30 guidelines I did on everything I have done on the Zoom. Then the third pillar is the CSR pillar. We must We are so lucky now. We are 200 million lucky people in our country. 1.2 billion are still, they want to be like us. We have got education, knowledge, house, happiness. They don't have it. We have to work for them. So that's why when our Prime Minister says, and I understand where he's coming from, we have to keep on giving to others. I always look at others and say, because they don't have anything, we are being happy. So it's very important to think of them all the time. So the third pillar is CSR. The fourth pillar is advocacy. He is sitting here. You have to give him all the time feedback. Sir, this we want for our fraternity, this we want for our patients. So advocacy is a very important pillar of the federation. The fifth pillar is fellowship. I consider it the most important pillar of organization. You must be friendly with each other. The fellowship is a very important pillar. And the fourth pillar is capacity development. We have to keep on developing capacity, help the government all the time to build more hospitals, more infrastructure, help our association members to live. Now we have come out with a full website. Just like Practo, I said, let us have a Practo where all our 41,000 members are there. Why only few members should advertise on Practo? Let us have everyone's information on Practo. So our federation is creating a website, it's already operational, where patient can access everyone. So if a patient is in Imphal, he can just go on the net, all the Imphal doctors will be there, they will come on the line, and the patient can just pick up a doctor and go nearby and get treatment from that doctor. So these are the 6 things, and then a lot of things I did in the CSR area, and one of my babies has been anemia, and after we finish our FOGSI, our federation has given us, they said, oh, बेचारे रिटायर हो जाते हैं प्रेसिडेंट, उनको कुछ तो देना जरूरी है, तो 3 बरस के लिए they give us one thing which we can continue doing, of course under the next leadership, because our federation is a continuity. Leadership continuity is very important. If there is no leadership continuity, it can cause disintegration in association. So, but I feel that we in India have a good, what is known as hierarchical leadership. There has to be the person, Modi ji has to be on top. So there has to be a person in our federation that is a continuously changing leadership. Unfortunately or fortunately, I don't know, but that leadership, so the leadership that changes has to continue the philosophy of the association. But we also, every time a president comes, we all listen to the president. But to have more continuity, we have the administrative group. So Madhuri Patel keeps the continuity maintained because the Secretary General is for 3 years. So that gives the continuity to the leadership. And so my baby has been anemia. I feel that's very important, and I'll continue doing the anemia work. And so before I stop my speech, I would like to show you one video of just 2 minutes. We covered 10 states, but one thing I missed out on. I missed out on the 7 sisters. And so one of the things I want to do in my next 2-3 years, I want to cover the 7 states. I will of course do it under the leadership of the next 2 presidents, Dr. Tank and Dr. Tandulwarkar, because they are the new leaders, but I will be their sevak, and I would also be the sevak of her country. So can you play, I told you that to put on the video. Will you play that video with the sound? Huh? Just play it quickly. Just play the video. So this is the anemia yatra which we started from Uttarakhand. We started from Rishikesh, and our BJP Chief Minister of Uttarakhand, Sri Dhameji, launched the yatra in those days. I remember 1 year back, and it went through the whole 5 states of Uttarakhand, then Uttar Pradesh, Bihar, Jharkhand, and West Bengal. Just could you put it on the screen? So this yatra, we covered the 5 states, and then we covered the 5 southern states as well at a secondary level. So nearly all the 10 states were covered. Everywhere we went, we did camp in the morning, then we used to do a public forum, and then we used to do a CME in the evening. So can you do it? Just play it on the screen. If not, then we can play it later on also. I think there is a problem. If it is not, we'll solve. I think maybe later on after our chief guest speech, if the thing comes in, we'll play it later on, just to show him what we have done. Okay, it's come. Go back. This was the bus I created, sir, the anemia bus with Procter & Gamble support. And we, like politician, we created a video rath also, where I used a 10-minute cartoon, which I played as we went around. This is All India Institute in Uttarakhand. Went to Ghaziabad, Meerut. Lot of press, everywhere we went. Aligarh. This is my Badlaav campaign. Agra, Kanpur, all our members. Lucknow. This was Allahabad on the banks of the river Ganges. Banaras. Mau is deep in Uttar Pradesh, a 5 hours drive from Lucknow. Patna, Muzaffarpur, Bhagalpur, then went to Ranchi, Dhanbad, went into the mines, sir, 1700 feet down. Jamshedpur, went to West Bengal. And nearly 100 million people we touched through camps, public forums, CMEs, and we would like to continue this in the Northeast as well. Thank you very much.
Thank you so much for the passionate and inspiring address, Dr. Rishikesh D. Pai, President of the illustrious FOGSI. Also, thank you for the motivating visual. May I now take the distinct honor of requesting the chief guest of the inaugural ceremony, Dr. Sapang Ranjan Singh, Honorable Minister, Medical Health and Family Welfare, Publicity and Information, Manipur, to address the esteemed gathering from all across our great country, India. May I request the gathering to give a loud clap for our chief guest. Seated on the dais
on this inaugural ceremony of FOGSI's Zonal Conference with Yuva 2023. The President of FOGSI, Dr. Rishikesh Deepai, the Secretary General FOGSI, Dr. Madhuri Patel, the Director of this esteemed institute, the Regional Institute of Medical Sciences, Imphal, Professor G. Sunil Kumar Sharma, the Vice President, East Zone of FOGSI, Dr. Alka Pandey, the Chairperson of the Organizing Committee of this conference, Dr. N. Subodha Singh, Dr. R.K. Paneswari, Dr. K. Pratima, Dr. Digel, the Secretary of the Organizing Committee, senior gynecologist of our state and the gynecologists who have come from other states, other senior doctors of our state, invitees, friends from the media, ladies and gentlemen. While I was just flipping through this souvenir, I did see one thing, that the lunch was to be from 12:30 to 1, but I believe the last session got a little delayed, and it would be wise for me, I think I should make my speech as short, because in an empty stomach, I don't think anyone would like to listen to any of the words, however beautiful or however bad it is. Well, when my friend Dr. James and Dr. Subodha, they invited me for the conference, I asked Dr. James, since he had been my friend since my pre-medical days, at least I'll be talking to people who are experts in their field, and a little mistake that I make, I wouldn't like to make that mistake. But he said, "Arey bhai, jo bhi man pe aaya jo bolte raho, okay? You just speak whatever you want to speak." And here am I, just to, on a few words that I would like to, as I've said, I won't take long. Dr. Rishikesh had put in some fine words of our country, of our leader, where our country is now. The path to progress, the path to prosperity, and the global recognition has increased by the day. Not being political, but yes, we owe it to a leader. A leader above all, a leader with a vision, a leader who thinks for all sections of the society. Just a few days back, I was speaking about how India is, how the world knows India as. As an example, I was giving about when we speak of Mercedes, it's synonymous with Germany. Am I right? I think it's Germany. When you speak of Sony, people think of Japan. And Samsung, Korea, football, Brazil. Well, in that way, India, some years back, it was known as not only on good things, or not on good things, but when they talk of India, people speak of open defecation. And where India is now. When we speak of India, as Dr. Pai just mentioned, Chandrayaan, when we speak of India, we speak of doctors across the world. When we speak of India, people know the Indians as one of the best engineers, the nerds, IT. The recognition of Indians globally has increased by the day. And this is something we all should be proud of as being an Indian. And as all of us know, that the global recognition of our great leader has been increasing by the day. Going away from a little being political to little away, it's really nice that such a wonderful conference is happening in our state. Though I was told that it was supposed to be held in the month of September, but because of the unfortunate incident that had taken place in the month of May, this had to be postponed. But nevertheless, it's happening now in the month of December, when the weather is getting a little cold, but the weather is still nice at this time as well, and it's really I feel really glad that I'm amongst the great doctors of our state and also of our country. Our healthcare, as far as the healthcare system is concerned, in the field of gynae and obs, I do acknowledge the commitment, I do acknowledge the help, the support that this FOGSI has been giving to us, and whatever things that need to be done for our state, for the welfare of for the welfare of the women of our state. They've been doing everything, whatever they could. They've gone the extra mile to make sure that all is taken care of in a very proper way. And it's a specialty, I should say, it's a specialty, as all of us know. When they come with a pregnancy for the first time, when we talk of ops, they come and you tell them it's positive, they go back happy. It's not like other disease. When they say you're positive for a disease, they go back a little sad, but in these things, they go back happy, and even after, during the delivery time, they all go back. It's it's happy face on the patient, on the relatives, on the wherever who is close to them. So it's this department. I would say the ops department is something which brings about a lot of smile to the people. And so it is. I acknowledge the service that's being provided here. But on the other side, one thing which really is of concern to us, one thing which is really of concern to us is the percentage of cesarean section in our state. It is a concern which I think we need to address together. While I was just flipping through this souvenir, I think in the recent category, in the recent trends of cesarean delivery, it says in India it's around 17.2%. 17.2% is in India, whereas the World Health Organization has proposed an incidence of cesarean delivery between 10 to 15, but India is 17.2%. And when we take, just for Manipur as a whole, it's whopping high. We have had meetings with the gynecologists at the level of the Honorable Chief Minister. We've had meetings with the FOGSI at my level. I would like to appeal, let's all do something about this to bring down, in spite of all the circumstances, in spite of all the problems, in spite of all conditions, all factors, I think we need to bring this down, the cesarean section rate. It's high. I wouldn't like to reveal the percentage. It's very high. I know we do have lots of factors, but I think we need to take this very, very seriously and bring it down. Since the World Health Organization says it's 10 to 15. If not this, I think it's from the present level. I think we need to work together. We need to have discussions. We need to have meetings about this so that this percentage comes down. And it's with the support of all the doctors who are present here that we can all bring it down together. And the institutional delivery in our state has increased. It's around 86%, which we plan through the mission of the government, that we plan to increase the number of institutional delivery as high as practicable, because it's something, institutional delivery is something very important that we take care, so that all patients, they come there and then get them admitted, get their regular checkup, and ultimately the delivery at the hospital. The maternal mortality rate, I think it was really wonderful that to hear that this Manipur is one of the better performing states as far as the MMR is concerned. And Madam, with the commitment of the doctors that we have here, and with the commitment of the leadership of the state, and with the commitment of all the healthcare professionals working at the lowest level, I'm sure we would be able to bring it down to a single digit. And we will definitely, we can do that, and we will definitely do that. And as far as even this, a healthy heart for a healthy life and healthy women. Yes, NCD is something which we all are concerned. The government is really working hard to make sure that, well, since the disease burden has shot up above 65% for NCDs, this is an area where we're working hard. Under the guidance of the Honorable Chief Minister, we had started around 2 years back. It's known as Chief Minister's Health for All, where door-to-door screening has been taken up for NCDs. And I think this is reaping fruits. We are getting to know people who didn't know they are hypertensive or a diabetic. So I think it's really reaping results, this door-to-door campaign to detect NCDs. And so this should also help towards better health care for the people of our state. And lots of this, as I've said, that CS cervix with the national immunization is going to be in the schedule. I think this is also something which the government has been quite serious about this matter at the level of the Chintan Civil that we had in Dehradun, and we were all discussing about this, this immunization, having this in the schedule, because this is very important, because the rate of CS cervix, the number of people CS cervix is also, we really have to take care of this. I think it's something really wonderful that the FOGSI is something working on this line as well. So at the end, once again, I was just talking to Rishikesh. He says he was in Imphal. He's in Imphal for the first time. He has been to Shillong, not in Imphal. So maybe, I don't know the others. Ma'am, have you been here before? First time, I'm sure. Madam is also here for the first time. And the rest, some of them were here. That's what I was told. I hope at this moment, in spite of what had happened, I'm sure you're having a wonderful stay here. And as I've said, in every conference or anything where I see people from outside our state, I said, please take back all the good memories. Talk about our state, talk about our, the history of our state. I should know the history of our state. It's unique in itself. Our state is unique in itself. Even the memento that you have here, that the Sangai thing, that has a history behind it. And that also is unique in itself. And I'm sure you're having a good time. And when you go back home, I'm sure you'll tell about our state, the good things, I said, not the bad things. Talk about the good things. And everyone has hopes, everyone has dreams, everyone has aspirations, and the hopes, the dreams, and the aspirations of every individual can be taken care of by a fraternity, it is by this medical fraternity that we all belong to. I'm sure we can give the hopes, the dreams, and the aspirations of every individual. And once again, thank you so much. Thank you very, very much. I don't know if I have overshot my time. I've said I'll just speak a little. I'm ending now. For having me here, and being in the midst of famous personalities, I should say. Thank you once again. And from my side, I just want to, just for as a token of care, as a token of support for FOGSI, I just want to hand over a check of just 50,000 to the organizers. And I haven't written anything. If this check bounces, you can always come to me. I'm always available. Thank you so much. Thank you. Thank you all. I'll just hand over to you.
Our heartfelt thanks to the Chief Guest, Dr. Sapan Ranjan Singh, Honorable Minister, for the straight from the heart address that deeply and truly motivated one and all of us. Thank you so much for the generous contribution of rupees 50,000 towards the success of this significant conference. Ladies and gentlemen, once more, a big round of thank you. At the twilight of the inaugural ceremony, shall we take a few moments to reminisce, to acknowledge and honor the legends of the IOGS. We shall now take the time to felicitate 19 senior members of IOGS. May I call them and please come together and stand on the dais. Dr. M. Kirada Devi, past secretary. As I call your name, can you please come so that we do not take much time? Dr. Anila, Dr. K.H. Tomba Singh, founding secretary and past president. Dr. C.H. Mangyam Singh, past secretary and past president. Dr. N. Jitendra Singh, past secretary. Dr. N. Nabakishore Singh, past secretary and past president. Dr. N.G. Indra Kumar Singh, past secretary and past president. Dr. T.H. Bidimukhi Devi, Dr. T. Rani Devi, first HIV project Manipur, ANI, India as PI. Dr. K.H. Ibayama, Dr. T. Bilashini Devi, Dr. S. Sangita Devi, Dr. Nabakanta Sharma, Dr. L. Ranjit Singh, past president and secretary, president MMC. Dr. Sanaton Ahantin, female dean, Churachandpur. Dr. C.H. Pritam Kumar Singh, past secretary. Dr. R.K. Praneshwari Devi, past secretary. Dr. L. Bimal Chandra Singh, past secretary. And Dr. James Elangbam, past secretary and present secretary, IMA. As I call out the names, I believe all the senior members of IOGS are present on the dais. May I request Dr. T.H. Netajini and convener of the reception committee to kindly do the honors of felicitating the senior members of IOGS. Ladies and gentlemen, presenting before you the legends, the legendary personalities of Manipur, senior members of the prestigious IOGS. Please continue to give them a huge round of applause. On the auspicious and historic occasion of the FOGSI Journal Conference with Yuva 2023, felicitation of the senior members of IOGS. The President of FOGSI, kindly doing the honors. It is a great honor. Thank you so much.
This video is brought to you by the Imphal Obstetrics and Gynecological Society.
A group photo
of Obstetrics and Gynecological
of the distinguished dignitaries along with the senior members of IOGS. A memorable moment, ladies and gentlemen.
Secretary General of FOGSI, and Dr. Ande as the Vice President of FOGSI.
The making of FOGSI East Zonal Conference. First time in the history of our state, Manipur, organized by the Imphal Obstetrics and Gynecological Society. The first Imphal Obstetrics and Gynecological Society, or IOGS, was formed 9th April 1979, and 4 NEOGS CON conferences were organized at Imphal till date. But the FOGSI East Zonal Conference 2023 with Yuva is the first conference at East Zonal level at Imphal, Manipur. The FOGSI East Zonal Conference with Yuva 2023 has 12 ICOG credit points for conference with 4 ICOG credit points for each workshop and 4 MMC credit hours for conference.
Thank you so much. May I now request Dr. K. Pratima Devi, Organizing Secretary, to propose the vote of thanks. Ladies and gentlemen, Dr. K. Pratima Devi.
A very good afternoon to all. I, on behalf of the Imphal Obs and Gynae Society, as well as the organizing team of the FOGSI East Zonal Yuva FOGSI, would like to thank all the members who are all the delegates, faculties who are present here. First of all, I would like to thank our chief guest, Dr. Sapam Ranjan Singh, who is the Honorable Health Ministers, who have agreed to grace the function in a very short notice. I would also like to thank our President FOGSI, Dr. Rishikesh H. Pai, Sir, who has come all the way from Bombay to grace this function. I would also like to thank Madam Madhuri Patel, Secretary General FOGSI, and also Madam Dr. Alka Pandey, Vice President East Zonal FOGSI, who have also come long way in spite of all the present turmoil which is happening in our state. I would also like to thank our Director, Regional Institute of Medical Science, Dr. Professor Sunil Kumar Sharma, sir, who have agreed to be the guest of honors in today's function. Thank you, sir. And also I would like to thank all the members, our team, organizing teams, the President of the IOGS and organizing chairperson, Dr. N. Subodha Singh, and my the Secretary, Dr. T.S. Digen, and Madam R.K. Praneswari, who is the reception in charge, who is also present here with us. And also I would like to specially thank our senior and also a past Vice President, Sir Dr. Bansab Mukherjee, and a very senior also, who is also a past Vice President, Sir, who is very senior and also who has taken a long journey, Sir Dilip Kumar Datta, Sir, from Calcutta. Thank you, sir, for coming down here. I'd also like to thank Sir Professor Sar Santa Singh, who was the past director and who is now serving as a director in Nigrim, sir. Thank you, sir, for coming down. And also I would like to thank our Professor Sir Sanjeev sir, who is serving as a medical superintendent and who has also come in to be present in this function. Thank you, sir. And all the seniors members of the Imphal Obs and Gynae Society, and also all the faculties who have come down here from very long distance. Thank you, all of you, and also others, the other delegates also who have come down here. Thank you so much. And also I would like to thank the media and the press who have been working very hard and who have been committed to come down yesterday during the workshop as well as today. The press and the media person, thank you. And I would also like to thank the security persons, the cleaning, the maintenance of these, all the halls, the 4 halls who are here, all the halls who are here. I would also like to thank the companies, the hospital, the clinics who generously donate and contributed for the success of this conference. And also I would like to thank the transport and accommodation people and also volunteers who have come here and who have helped us to make this conference successful. I would also like to thank the decorators who have also made this hall very beautiful. And also at the end, I would also, at the last, I would like to thank all my IOGS members who have helped to make this function successful. Thank you all. With this, I will add my words. And the lunch is there, and the lunch is there for the faculty. Lunch is there in the first floor, and please have lunch, sir. The chief guest and the president and all the who are present, as well as all the faculties, can have the lunch in the first floor in front of the Jubilee Hall. And there is a lunch also in the delegate lounge. There is a lunch. I think all can have before the session. Thank you.
Ladies and gentlemen, please rise for the national anthem.
Hey, go now.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे. Thank you.
The curtain has now come down upon the inaugural ceremony. Long live FOGSI! Long live IOGS! Hanna Hanna Thagachari, that is in Manipuri. Heartfelt thank you. Amukka Hanna Kurumjari. Once again, I bow before you in respect. Jai Hind.
Federation of Obstetrics and Gynecological Society of India, with Dr. Hrishikesh D. Pai as the president of FOGSI. Dr.
Just hold this memento, no? Memento, somebody.